Good afternoon, members of the Adults and Health Committee and members of the press who have joined us today at New Shire Hall and online for the Adults and Health Committee. For the purposes of this meeting, as both the Chair and Vice Chair have given their apologies and are unable to attend the meeting today, members are required to vote in a member of the committee to chair the meeting for today only. Please can I ask for any nominations for members to chair the meeting along with a proposed seconder? Councillor Slatter.
I'd like to propose Councillor Alex Boulat.
Councillor Bowden.
Happy to second.
Okay. All those in favour? Thank you very much. Councillor Boulat.
Thank you for your patience. Good afternoon, members of the Adults and Health Committee and members of the public and press who have joined us today at New Shire Hall and online for the Adults and Health Committee. For the purposes of this meeting, we have already voted for the chair and the vice chair is Councillor Philippa Slatter. For today, who will help me with the speakers list. It's the first time I chair a committee, including such an important committee. So please do bear with me. Good luck to everyone. And I want to also send our best wishes to Councillor Howitt, who's unfortunately unwell today. So we wish him a speedy recovery. The County Council allows filming and photography at its public meetings. So please feel free to take pictures and use social media during the meeting. Can I ask, though, that everyone present turns their mobile phones to silent or vibrate whilst the meeting is taking place. Please be aware that this meeting is being live streamed and that the recording of the meeting will be available to view on the County Council's website. A couple of housekeeping points for committee members. To register your wish to speak, please do raise your hand. Also, in accordance to our constitution, I'll briefly adjourn the meeting for a comfort break if the meeting exceeds 2 hours. There is no fire alarm test scheduled for today, so if the alarm sounds, I will adjourn the meeting and we'll all leave via the fire escape, which is situated halfway along the corridor outside this room next to the kitchen. There are external stairs to the car park and assembly point. Now, item 1 is apologies for absence and declarations of interest and announcements. First of all, before we go on to the apologies of absence, I would like to pay tribute on behalf of us all to Councillor Mac Maguire, who sadly passed away recently. Mac was the County Council's longest serving councillor, having been first elected to the County Council in 1985, and then again continuously from 1997. During that time, he held a number of key roles, including Chair of the Council, Deputy Leader of the Council, Cabinet Member for Highways and Transport, and Cabinet Member for Community Engagement. He also served on the Adults and Health Committee up until recently. He will be greatly missed by members and officers across the Council and by our partners across Cambridgeshire, and our thoughts are with his family at this sad time. I would now like to welcome Councillor Kevin Reynolds, who would like to say a few words about Councillor Maguire.
Thank you, Madam Chairman. As you're probably aware, I was honoured to say some words on behalf of all the members at Mac's funeral, and I'm delighted to say such was the high esteem and respect he was held in that members from all sides were there, and that was a great comfort to the family. You gave a very good synopsis of Mac's career on the council, and I'm sure there's going to be a longer eulogy and acknowledgement at the full council meeting. Everybody who came into Mac's contact was impressed with his knowledge and his sincerity. I can't add much more to what you've said because we're going to say a lot more at full council. We're all very sad and surprised. In fact, he had a very short illness, as you're probably aware. These things take us by surprise. And unfortunately, it's one of the sad things of life. Thank you.
Thank you, Councillor Reynolds. I would like now to invite committee members to stand for a minute to pay tribute on behalf of us all to Councillor Mac Maguire. Thank you. you. Please be seated. Okay, we're moving on to apologies for absence. Would the Democratic Services Officer please report any apologies for absence for today? Thank you.
Apologies received from Councillor Howitt, substituted by Councillor Bradley Goodliffe, Councillor Susan van der Ven, substituted by Councillor Edna Murphy, Councillor Graham Wilson, substituted by Councillor Ross Hathorn, and Councillor Adela Costello.
Thank you. And now, does any member wish to declare any, sorry, apologies, Councillor Count.
Yeah, just regarding apologies, I'm very sorry, but I have to leave the meeting at 4:45, Chair.
Thank you, that has been noted. So now moving on to declarations of interest. Does any member wish to declare any disclosable pecuniary interest or non-statutory disclosable interest? No, thank you. Okay, we're moving to the minutes. Okay, here we go. Apologies about that. We are being asked to approve the minutes of the meeting on the 14th of December 2023 as an accurate record. The minutes can be found on pages 5 to 25 of the agenda pack. If any committee member wants to raise a question on the accuracy of the meetings only, they can do so now. Okay, I see no objections, so we'll take those as carried unanimously then. Thank you. I do also have an updated action log also included in the published papers for this meeting at pages 27 to 35 on the agenda pack. Does anyone have any questions or comments on the action log? Councillor Slatter first, please.
Yes, on minute 169, which was about the major trauma unit, you'll see in the actions, on response, we hope will be to the liaison committee, which is actually tomorrow. So I may need to bring just report back to members of the committee on what was said. But we may have something in writing. I hope so. Thank you.
Thank you, Councillor Black.
Thank you, Chair. I'd like to just bring up a matters arising on the minutes at page 5 of our documents regarding the collapse of Beaumont Healthcare Limited, which I brought up at the last meeting. And I do think it is a shocking failure that we have a situation where a workforce that are desperately needed in this country and whose jobs still need to be done have been made redundant and have faced deportation. So I wonder if we could have an update right up to date of where we are, as I think we're coming to the sort of date when, if people are going to be deported, they may well be in jeopardy of it now. There was an action point for the number of workers who we've actually helped into other jobs, and I wonder if we could have an update of, precisely how many we have helped and what we've done. I'd also like a little bit of an update on how the consultation that we've had with the unions about this has gone, and whether the council might be able to quantify basically what Beaumont Healthcare have cost the public purse in withdrawing in this way, because we know that it's been most inconvenient for the council and that they have gone under owing HMRC a lot of money, quite a lot of other creditors, and the redundancy payments that are resulting are going to be having to be paid out of the public purse, as I understand. And this is a company where associated companies are continuing. The same director and the companies that own Beaumont Care are continuing in healthcare. There are a number of companies doing other work in healthcare, including in domiciliary care. So I'm just wondering if
Mr. Black, sorry to interrupt you, but this item relates to only the accuracy of the minutes. So I do appreciate all the points that you're raising, but just so it's like only about the accuracy of the minutes.
and the action log, I believe.
And the action log as well. So like, can you specify what point you're referring? Because you're making a number of points. So I do struggle to know exactly what.
So we have an action required on the action log. I would also like us to at least have a chance as a committee to know if we can expect any similar failures coming up before we next meet.
Thank you. I believe Patrick wants to respond to that.
Yeah, thank you, Chair. We'll take that action. We can provide you with a further update onto it because there's some details there which may be confidentially sensitive and commercially sensitive. So we will take that as an action and provide that information. I would say that the unions have been in touch with us as a directorate just to offer their thanks for the support that we've given to that workforce to help them as much as possible to find alternative employment, which many have done. But in terms of the details that you're asking for, Councillor Black will need to go away and provide that information outside of the meeting.
Thank you.
Thank you. Are there any other points? Councillor Bowden, please.
Thank you, Chair. In relation to point two, they're all point two to do with the health scrutiny work plan and health inequalities. We have been told that we may receive some information about how we may constructively scrutinise health inequalities, which is still just regarded as being in progress with no date being given. Can we have a date, please, by which that may be made available to us?
Thank you. I do agree with your comment. I had a similar comment to make on the action log in terms of the health scrutiny plan regarding looking at NHS dental services, which I believe that we discussed in other previous committees to put it on the agenda. So it would be very helpful if we can have an update on some of the dates when this will be discussed for the next meeting. Do you want to say anything now? Does any officer want to say anything now about this item? No. All right, then are there any other points about the action log? Okay, in that case, we will take the action log as noted. So moving on to agenda item 3, petitions and public questions. No petitions or public questions have been received, so we'll move on to the next item now. So item 4 on the agenda is the business and financial plan for 2024-2029, which is on pages 37 to 136 of the agenda pack. Patrick Warren-Higgs, Executive Director for Adults, Health and Commissioning, and Joy Teatri, Executive Director of Public Health, will introduce the report. They are joined by Michael Hudson, the Executive Director for Finance and Resources. Justin Hartley, Finance Business Partner, is also here to assist with any financial queries. So now I'll move on to the officer report, please.
Thank you, Chair. Good afternoon, everybody. I'd like to just take this moment just to introduce the paper. So today's proposals are based upon delivery of the Council's strategic ambitions, in particular for more care in Cambridgeshire, alongside development of a decentralised, locality-based offer providing services closer to communities. The focus of our work is to work together with system partners is to strengthen the opportunities of individual residents and communities to be able to access support at an earlier stage in their lives through a preventative model which will strengthen their independence in the longer term, lead to delayed, reduced or even prevented intervention by adult social care and other services. But in order to enable this to be achieved, requires a more proactive approach, developing initiatives with local residents, improving the openness and transparency with the care market, creating opportunities for more people to undertake a career in social care and change the way our practitioners work with and think with those people who draw on services. This will include exploring alternative models of delivery, particularly around the expansion of the Care Together programme, alongside the opportunities of specialist bespoke and general needs accommodation through the use of capital funding and closer collaboration with other system partners, including district councils. We will also use this opportunity to maximise the use of our in-house services, focusing on growth and diversification, as well as considering other efficiencies and improving their effectiveness. These proposals are set amongst the backdrop of challenges for our providers around their workforce and financial pressures with rising demand for services. But we're building our work, which is already underway, such as the work with system partners improving discharges and the opportunities for developing our in-house services. This work will be undertaken whilst continuing to meet our statutory duties as set down in primary legislation, including the Care Act 2014. As you will see from the paper presented before you, whilst there are proposals to deliver savings whilst modernising our offer, Adults Health and Commissioning will see a net investment of over £16 million if these proposals are supported. I'm happy to take any further questions, and I'll offer those to the Chair and the committee. But I'm joined only by Will Patton, Service Director for Commissioning, to my right, and I've got some colleagues in the room who will hopefully be able to answer any further questions that you may have. I'll hand over to Jyoti now to add some further context from Public Health.
Thank you. Similar to Patrick, our proposals also support the delivery of the corporate priorities and respond to the findings of the Quality of Life survey. We've also got some increases in our grant allocation that will support covering the agenda for change pressures that we've got, and we've got some additional money for that's ring fence for tobacco control. And I'm happy to answer any questions. Thank you.
Thank you for the report. So now moving on to, I will take this the questions on this item as a whole report. I know in other committees we have done it section by section, but I'll just take questions one by one and allow the officer responses on it. So I have Councillor Sif first, please.
Thank you, Chair. I've got a number of questions, as I'm sure we all do. I'm just going to ask, if I can, an overall question, really about the whole budget and how our budget for this committee fits in. I will then ask detailed questions, but I'll give other people a chance to get in as well. My first question is that yesterday, Her Majesty's government announced that there's another 500 or 600 million pounds, I'm not quite sure, to come into county or councils generally. I don't know what our share of this would be, but can I take it that the overall deficit that is being forecast, the shortfall in the budget of 2 million, will be covered, and we don't have to worry about that anymore? And whether indeed the reserves that we are using for some of the services can be replaced. So that is my first question.
Thank you, councillors. I believe Michael will respond to those questions.
Thank you, Chair. Yesterday's announcements contained two elements. There was 500 million directed at social care and a further 100 million directed at a number of items, including ensuring that the core funding increase minimum was raised from 3% to 4%. That will impact on our districts particularly. So the element that we're working through at the moment isn't known to us, because the final settlement we expect to be the 5th of February. So at this stage, we don't have any of the details around the grant allocation, nor do we have any details around the terms, if there are any terms and conditions. Members may recall that last year's social care grant came with a number of reporting requirements. So we are still working through that. So it's probably too early to answer your comments in the fullness of time. We will through the reporting position as the final settlement is known. I would point out the Strategy, Resources and Performance Committee papers were uploaded earlier on this week, and that addressed the position related to the £2 million deficit that was reported at December, and proposals now are balanced, subject to debate and to confirmation, and that will come forward for debate next Tuesday, along with any comments from this committee.
Thank you. I have Councillor Goodliff next, please.
Thank you. I'll keep it brief. Really pleased to see that this budget has responded to the survey that was done of our residents and the work that continues with anti-poverty and investments into mental health. Really hard work in terms of officers in order to balance a budget in an incredibly difficult climate when county councils across the country are saying how hard it is to find a balanced budget. So really pleased that these priorities have been brought. Thank you.
Thank you. Do any members have any other questions? Councillor Sif again, please.
Yes, thank you. I'm surprised that there aren't any more. I could probably have a little questions about many aspects of the budget, but if I just pick on one area, public health budget, I was rather concerned that the only uplift for this year seems to be for inflation rather than demand, or what has been called pressure. I think within the last week or two, we read that there's a measles amongst young children is catching and increasing at an alarming rate across Europe and in the UK. The STDs are rife and they've been increasing rapidly post-COVID. And the police have said that they're not going to intervene in mental health cases that are referred to them unless it's a matter of life and death. And they're not that good at doing that either, I might point out, from some things that we've read recently. And my question is, how resilient is that budget? Surely the demand is growing, and can we cover everything that we're likely to face over this coming year, never mind future years? It may be that we just flag these things up as risks, but it seems to me that I was surprised to see that there wasn't a specific. Now, I know we're limited with money and that we can only do what we can do, and there are priorities, but those particular items that I've identified seem to be fairly important, and I don't know how they're covered. So perhaps I can ask that question.
Thank you. Michael, would you like to respond to any of the previous points, or maybe Jody on the public health element? Thank you.
You're absolutely right to recognise some of the risks, and they are risks that we are continuing to grapple with. There is pressure on our sexual health service. We are concerned about being able to offer population-based alcohol prevention. There are lots of things that we are unable to do because we don't have as much money as I would like, unfortunately. I can give you some assurance around measles. We are messaging our schools, working with our health providers and workplaces to encourage vaccination uptake. We've got a small window before it really gets here and takes a hold. So we are working with comms to get those messages out and to push vaccine uptake, because that really is our only defence at the moment. Once it gets here, and I think it's a matter of time, to be honest, it will cause immense pressure in the Midlands, where they've already had outbreaks. Children have had to isolate if they're not vaccinated for up to 21 days. And in fact, there was a whole school closure as well due to concern that measles was spreading. So you're right to highlight that as a concern. It's one we're taking seriously and are acting on now.
Thank you. Patrick?
Yeah, thanks, Chair. On the right care, right person reference that you made around the mental health service and the police, just to say that we're working closely with Cambridgeshire Force, along with our system partners. There are 3 phases intended to roll out. The first phase is rolled out, and we haven't yet quantified any of the risks. The phases 2 and 3 are still being worked up, but at this moment, it's very difficult to understand what risks there are and how we would quantify those. But we will continue to do that into the new financial year, addressing those risks with our partners. But then if there are any financial implications, we would need to reconsider it at that stage.
Thank you, Patrick. Councillor Daunton, please.
Thank you. Two questions. One related to Care Together and another to the independent living service. So in Patrick's introduction, he mentioned Care Together. I'd like to know a bit more about where the funding is going, a little bit more detail on that. And on independent living service, on page 60, it mentions that we're exploring alternative models of delivery for residential and nursing care provision. Some more details on that, please. Thanks.
Patrick, please. Yeah.
Thank you, Chair. I'll ask Will to respond to those questions.
Thank you. Thank you, Councillor, for the question. So first of all, if I could give an update perhaps on the independent living facilities first, and then come to the Care Together question. So within our plan, we have plans to open 2 independent living facilities, one in Hunts, and this is being commissioned. We expect that facility to go live around April 2025. And then there is a second site planned, which we are planning in conjunction with our health partners, and that's the Prince of Wales site in Ely. The lead times for that are a little bit longer, so we intend to see planning being submitted in summer of 2024, purchase of the land, we would hope to be around November 2024 for construction to be completed in April 26. And the proposals that we're putting forward, subject to further business cases, is around us owning that facility in the Prince of Wales site. As far as Care Together is concerned, again in the plan, as the committee will know, we've been operating largely in East Cambs. Our plan is to expand Care Together across all districts. In fact, that work has already started with a focus on all age rather than just 65 plus, with a strong emphasis on prevention and early intervention, keeping people at home, living in their communities for as long as possible. So the Care Together money is to help support that, which includes the continued development of very small businesses in those localities, for example, much more co-production with local communities, thinking about areas that we can invest in prevention and early intervention. And then also within the plan, we've asked for some external help to come and help support some of our thinking about how we can expand the Care Together principles even further across the whole of Cambridgeshire.
Chair,
yes, please.
So through you, Chair, could I ask for a general update for members, maybe to this committee, on Care Together? You mentioned it's expanding into other areas apart from East Cambridgeshire. I think it would be good if we were all, thanks.
Back to Will.
Yes, thank you. So from memory, I believe that we're taking a paper around Care Together to, I believe, Spokes in March. And that will be a very detailed paper about our plans going forward, and what we would expect to the areas that we'll focus on, and we'll be looking for input into that direction.
Thank you, Patrick.
Yeah, thank you, Chair. A note from the action log, there's an action for me and Jyoti around member training and development. So if it goes to Spokes, but there's some potential to have a broader session in a training slot, then potentially we could look to plan that in as part of our work on that, arranging the future training development plan. Thank you.
Thank you, Patrick. I'm sure that update will be useful for all members. Next on my list, I have Councillor Murphy, please.
Thank you very much. Is it all right if I ask a question about one of the appendices, or are we coming to those later?
Yes, please do refer to the whole paper. Yeah.
Thank you. So I've got a really specific question about the business cases. I just want to make sure that I understand what I'm reading, and apologies if everyone else in the room understands it and it's just me who doesn't. But if you look at page 6 of that, there's an investment of 3.3 million, and that produces savings of about 14 million, and is what it looks like. And what I'm really wanting to understand is the mechanics of it. So if the expected expenditure for those 6 areas was about, call it 20 million, just for the sake of argument, we're adding 3.3 million, so that's 23.3 million we're going to spend on those things. And then in 24-25, we're realizing a saving of 6.4 million. Is that on the 23 or on the 20? And then if the following year, it's another 4 million saving. Is that from the level where we've achieved 6 million saving, or is that back to 20 or 23? Do you see what I mean? I'm because I think if you have a decrease in the baseline expenditure, it should be a recurrent saving, but it says it's a one-off. So I'm just Am I making any sense in my question? I think it's just the mechanics of what that table is saying.
You are making sense, councillor, but Justine's got more sense than me, so I'll respond to that one. You are making sense.
Okay, thank you. I'm going to try and put this into really readily understandable words. So what we've got is a 3.3 million one-off investment into work that will deliver savings that are recurrent further down the line. So what you're seeing in the business planning numbers in the investment section is that one-off investment going in and coming back out again. The savings then sit further down in the savings section and come out on a permanent basis, as you say they should, in the savings bit. So, and what we've tried to do is reference them all across to each other, but that's why you're seeing that in and out, and then the savings that sit separately in the savings section of the tables.
Thank you. If I may then, so the saving here is the change that the particular investment will make in any particular year, but the actual saving will be against what a baseline would have been, which would be recurrent and would be increasing over time, if you see what I mean.
Would you like to come back on that? Good.
Yeah, so if in my mind, I'm just imagining that 20 million is that, I mean, I know it's not, but call it 20 million, and we're putting in an extra 3.3. And then the following year, the expenditure on those items isn't 23, it's minus 6.4 million. So it's 17.
Yeah.
And then the following year it's 13 because we take another 4 million out. And so every year, what we've done with that 3 million is every year we've saved ourselves what we would have been spending against what we are spending. Or does it not work like that?
No, it doesn't really work like that.
If it doesn't work like that, I'm very happy to go off and take a tutorial separately, but I'm just trying to relate it to a recurrent sort of budget line.
Yeah, so adults has obviously got a 214 million net budget overall. We're talking about spending 3 million to work up projects and things to deliver savings through the longer term. So you're not comparing it against the actual budget against which those savings are taken, because that's the generic overall whole adults budget, and the savings go across the piece.
Thank you. Councillor Steve, did you indicate another question, or was it the previous one? Because I have you on my list again. Just to clarify if there's another one.
Sorry, I'm not trying to hog the show here. I look through it and I see numbers and I think, I wonder where they came from. And I'm particularly looking at 412 and BR 4002, the older people pressure from additional growth in 2023-24. 3.2 million. This is partly a question about my ignorance, probably how you derive these figures. As far as I can work out, it's a one-liner. There's no detailed analysis of this in the appendices. Is it just on the basis of a forecast of population growth? I mean, or population growth in certain age groups? I mean, how is it done? Where do you get the figure from? And well, obviously, you're not providing for it in future years. I mean, we obviously have to be thinking about how it will extend and grow over those coming 5 years as well. But it's treated as a one-off, or seems to be here. Just how is it? How have you derived the figure?
Thank you.
Okay. Yeah. So the way that the whole demand and demography section works, I'll come back to that little pressure of 3.2 million in a minute, is each year we look at the trend data, what it's showing us, how much we think we will get in growth in demand for services or increasing costs. It's not always numbers that go up. And that's what we do with our demand and demography pressure each year. Now, because of the pandemic, we started to see a real shift in the trends for older people placements, people not going into care homes in the way they used to. And so the trends were all very different. So when we built last year's business plan, we actually had quite a low demographic bid last year. that was based on what we were seeing at the time, and we expected it to continue because we expected to continue sort of that resistance to care homes. But actually, as we've gone through and time's gone by, people are going back into care homes more than they were before. So that 3.2 million is actually based on what we're seeing in 23-24. So we know what we're seeing at the moment. We know that our numbers are running this year ahead of where we expected them to be in last year's business plan. And that's what that 3.2 million is about. So it's a catch up basically on underestimating the trend last year. Obviously, it is all very much done on trend analysis, and we make our best estimates, but sometimes.
Yeah, well, that's what I thought you were going to say. It's not a straight line, though, is it? I mean, the baby boomers are coming on, and in the next 5 years, and possibly this year, you've got over 80s. The over 80s are increasing. The over 85s are increasing. So I just wonder how that's. I mean, if it's just what we underspent, or sorry, hadn't budgeted for last year, is that? Can we assume that that's exactly what's going to happen again this year?
Thank you. Just to say that on that point, before we move on to another point, can I bring in Patrick, please, to comment on this?
Thank you, Chair. So, so the finance and performance reports which we brought to committee have highlighted this, that actually we saw a rise in our bed numbers during the summer months over and above what was forecast. And it's that projection that Justine's talking about, which we get the full year effect running into next financial year. Now, if the numbers, the demography and the change in the bed base between now and the end of March happens, then that potentially will impact on that. But at the moment, our best calculations are based on current numbers, assumed admissions, assumed discharges into at the end of March and then into the 24-25. Hence why there's a cost pressure there, which is being reported.
Thank you, Patrick. I'll move on to the next question because we still have a few speakers. So Councillor Bowden next, please.
I've got a couple of questions. First one, if I may. I'd just like to explore a little bit about what is called the vacancy savings target. And I think that's a rather strange phrase to use in this particular context, because it almost looks as though we are trying to ensure that we don't deliver all of the services that we're meant to by not having all of the stuff that we need to deliver those services. Now, we're told that the vacancy service savings target will be increased from about 1.3 million this year up to about 1.9 million next year. And I understand the logic behind it, and I see the history coming up to that. So I understand why that is being done. I find it a bit strange that it's almost looked at as a positive thing that we've overachieved that target. I'd have said, if anything, it's actually in many ways negative, other than the financial side, because we're failing to do what we set out to do. But what I don't see is how this assumption that we are going to overachieve our vacancy savings target, how this is reflected in the cost of services which are provided. Because presumably with the vacancy savings that we are making and the number of vacancies, there will be some degree of service in some areas. I know learning disability and reablement are separate from this, but there must be some areas where we will not actually be performing the services that we have budgeted for. And I haven't seen the link there. I haven't understood the link between the expected failure to have all the staff that we want. And I know that there are some interim staff will be appointed and there are costs against that, but I can't, it's not transparent to me where the link is between the staffing levels we'll have, the cost of the interims who come in, and the reduction in service that we'll have as a result of not having net as much staff as we would have expected. And I wonder if I could be given just some information about that, please.
Thank you. Would Justin want to?
Yeah. The numbers are that.
Okay, yeah, and I mean, I completely take your point about, and I think the terminology, we called it vacancy factor. I hadn't realised it still said vacancy savings in there, because you're absolutely right. It's not really something that we're aiming for. We are aiming to be able to deliver those services. I'm sure that's what Patrick will say. But the reality is that we're in a difficult market and we can't recruit. I guess what we don't want to do is to be making savings somewhere else when actually we know we're going to underspend on this. So quite a lot of it's really about reflection of the reality of the position that we're in, rather than go and make savings somewhere else. Better to reflect this, and it could shift up or down over years. You know, if we get to a position where we're more able to recruit, certainly.
Patrick?
Yeah, thank you, Chair. So I suppose the way that we report it is in terms of some of our waiting lists, and actually in terms of where you look at our performance, it's credit to the workforce who operate probably over and above. They work exceptionally well to cover the vacancies and the churn that we get through natural turnover of the workforce, but we struggle particularly in professional qualified staff in social work, in occupational therapy, etc. So whilst we are focuses on recruitment of that staff, we do use the interim market, but we also, our workforce continue to carry and work significant workloads in order to make sure that we meet our statutory duties. But the downside of that is that we have waiting lists. We have waiting lists for people for assessments and waiting lists for people for reviews and reassessments. Now our performance is really good, and that's credit to our staff for that. But that's how we net it off. What we don't highlight is the gap in that, because we work with the resources that we've got, and we work with interim resources to come in and support that pressure of the workforce. But what we would want is we would want to have a lower vacancy factor and not have the churn that we've got of our workforce. So that would be our focus. But the vacancy factor that we carry this year, we've exceeded, and therefore, in order to make the budget balance and to work for it, we propose that we would continue with that, because whilst we are working hard to bring new employees in, we're still seeing steep people leaving. So we've got that churn that we continue to manage, but we would like to see the vacancy factor reduce, but at the moment it's not doing.
Councillor Bowden.
Let me just have a follow-up on that question. I fully understand the comments which have been made, and I understand it from an accounting point of view, but we're not talking about something which is new here. This has been the case in adult social care, and for that matter in public health as well. But this has been the case for a long period of time, and there's no reason to believe that it's not going to be the case for some time to come, for many years to come. In which case, why are we not trying to rebase our costs to match what we believe our actual staffing levels are going to be? Why are we effectively budgeting for a quote full complement of staff in the full knowledge that we're not going to have that full complement of staff, and then we put in this vacancy factor target, if I can use that word again, unfortunate word again, which we are tending to overachieve each year. It just seems to me as though we are adding in order to subtract when we should be reflecting reality.
Patrick? Justin then.
So the reality is we have an establishment, those are all the posts. People resign, they leave, it takes a while to fill. And so a lot of that vacancy factor is not coming from a permanent post that you could take out and rebaseline. It's that inevitable gap almost between one post ending and another one coming in, and a lot of the vacancy factor comes from just that gap. But when you cumulatively add it across the whole workforce, it adds up quite quickly.
Thank you. Michael, please.
Thank you, Chair. If I could just add to that. So I think the question is about, is it the right establishment as it sits at the moment? And from discussions and debates we've had through the process of bringing this budget forward, we've established that it is the correct establishment. There are clearly proposals to change that up and down throughout the proposals, but there's a reflection, and it's across all areas of the council, that the service will have a period where not every single post is filled. And as the Section 151 officer, what I'm conscious of is that if that budget is within the services and we are looking at the overall management of this, then we want that to be spent appropriately as opposed to challenging and making savings elsewhere. So we're recognising that this will happen. One of the things that I am doing, though, is providing through the reserves that if there is such a case, if it ever were to happen, and we've got the trend record on page 128 of the electronic versions in terms of the business case, which gives the previous year's history. And there is a paper coming forward on the next, or one of the next agenda items on procurement of support for the business to maintain performance. then we would look at that position through the budget monitoring and assess whether the vacancy level was at where we expected it to be. There is always an element of estimation with this figure, and we will review that through the budget monitoring. And if it is overachieving, then that will be looked at just as much as if it were underachieving in that. And if it were to underachieve, then I will be looking at, firstly, are there other savings that can be made? And if it is because significant improvement is being made and performance, etc., then what is the need for the reserves to be called down for the for correcting the assumptions that we make today, as opposed to what we know in 9 months' time or whenever it is.
Thank you.
Finally, if I may, thank you.
One more
Really
question.
quickly, just to follow up on that, I fully appreciate all of the comments just made by Michael and fully understand them. But would it not be accepted that really talking about making savings targets, having a savings target for underemployment and looking to overachieve that target, the word target is really rather an inappropriate one to use here, and maybe we could find some rather better nomenclature to explain what it is that we're doing, rather than to make it look as though we're deliberately trying to make savings through not having a full complement.
I think that's a fair point. Michael, do you want to come back on that?
I was just going to say, having a dyslexic as a director of finance obviously isn't the thing to do in terms of the wording. So I agree with comments around the wording, and we'll take that forward in terms of learning.
Thank you. Councillor Count, please.
Thank you, Chair. A couple of points and some questions. First of all, in terms of the recommendations, which are basically to bring the joint administration's plans in front of the full council. I'm not part of the joint administration. It is part of a combined package: adults, health, highways, resources. They all form part of a multiple package that ends up in front of council. And so I don't really want to support any of those in their individual nature, to avoid being tied up in them, as I have been in the past, saying you voted for this at committee level. So I won't be supporting the recommendations, but you have sufficient votes as the joint administration to get that through. So just letting you know my position on that. In terms of questions, the first one I've got is quite relevant to the conversation we've just had. The conversation is about actually the staffing levels in adults and public health. I don't know if the rest of the committee have had the advantage of seeing the employee engagement survey that I have, but it's quite obvious that both adults and the public health departments are outliers in terms of staff turnover, etc. And there needs to be some work there. In fact, the adults social care is also on the government site, Oflog, and it's an outlier there nationally. So one of the things we've been talking about at the Strategy and Resources Committee is asking for benchmarking of the workforce, because all we ever get told is nationally there's a shortage, and we've been struggling to get some benchmarking. But now when we find some benchmarking, such as the Oflog reporting on the adults and health, we haven't got it on highways yet, we find that Cambridgeshire is an outlier. So work needs to go on in there. I was complimentary of the work that went on earlier about the children's department that grappled that thorny issue quite earlier on. And I've been waiting for the work to go on in the adults department, and there is some work going on in the adults department. This is where I'm leading to with my first question. So my first question, I just want to understand some of the work that's going on. So on page 47 of the pack 3.21 regarding the workforce challenges. There's been the creation of a care academy, Care Academy, and it described as which will provide a training and skills portal for external social care staff. So I just wanted to understand, was the academy purely an online academy, and what qualification do participants achieve? So that's the first question I've got. The second question, if I may, is on page 48, ambition 7, 3.25. It says the largest proportion of the public health grant is spent on children, 34%. I'm not really sure how largest anything could be 34%. So perhaps we could have an explanation around that. I haven't got a problem with it. I just want to understand it. How can the largest of anything be 34%? Because I only thought there was children and adults, but maybe there's subdivisions of babies very young children, teenagers, etc. So just some help with that one, please. The third and fourth question really relates to what Councillor Seif was asking about yesterday, for some extra information on how we end up with some of the figures that we do end up with in the predictions for coming years. And the two that I've isolated, if I may, and this may be one for you to take away, please. But on page 51, 3.001, additional funding for older people demand goes from 4.562 million up to 21 million over the 4-year term. And the next one is on page 51, 3.004A, additional funding for learning disability demand. That goes from 3.297 million to 16.731 million. And these enormous jumps just jump off the page at me. Now, when we asked in committee like this, how do you arrive at numbers? We get the answer that you got. It's a combination of, we have more complex demands, we have demography, we have inflation, and there's a sort of a pooled response. But actually somebody did the working out. So I'd love to see the working out for the two that I've picked up so that I could actually follow it. And I think the committee would like to see that as well. So is it possible to have the actual methodology and the tracking? We have graphs and we have linear lines, etc., showing how we got to those figures, circulate to the committee afterwards on those two questions, please. Thank you, Chair.
Thank you, Councillor Count. Patrick, over to you.
Yeah, thank you, Chair. On the Care Academy, I'll go to Donna first.
Hi, thank you for the question, Councillor Count, about the Care Academy. It's a very timely question because we had a face-to-face launch last week. So the answer is no, it's not just an online offer, but it does offer one online place for all care workers, care providers and PAs, personal assistants who are employed directly by people that we provide direct payments for, to access information about what the offer is. And we've launched it with an offer which is really strong around the baseline set of skills in the market, which is the care certificate. And there are 3 offers around that. 2 of those include a face-to-face element, but we do acknowledge that for some of our workers, an online only way of accessing some of the training is the most accessible way to do it. So it's a blended approach.
Thank you. Michael. Do you want to come? Sorry, Jyoti first, then Michael.
Yeah, I think the 34% refers to services that are exclusively for children. Of the other 66%, there are services that are for adults only, but there are some all age services as well in that mix. I hope that explains. Yeah.
Yeah, so the 34 is solely for children. Then you might have another percentage for children and adults. So that makes 34 the largest single element. That one's understood.
Correct.
If I may go back just on the care. So you said that there's a we have a retention problem now. It'd be useful if we can accelerate everything, I think. Thank you.
If I can just come on back
Yes.
on that really, really quickly. So in terms of the pathway, it was our original intention to develop a pathway ourselves because there isn't one set out nationally in a very coherent way. During the very first stages of that thinking, the government announced they were developing a pathway for the care sector. And in the same announcement that came out a couple of weeks ago about the care certificate, they've offered the first iteration of that. So rather than duplicate, we paused for a moment just to see what that was going to look like. So we'll build on that now in Cambridgeshire.
Thank you. Michael, I believe you want to respond to some of Councill's questions as well. Thank you.
Chair, yes, thank you for that. And in relation to page 51, in relation to BR 3.00 and 3.004B, no, A wasn't it, in terms of the items related to older people and learning disabilities. This, in the first instance, the second column is the spread of years 2025 to 2029. So that's a 4-year financial period. So the average in the case of older people would be, just working it out, about 5.3 million. Across those years, that would be a steady increase of growth, and the learning disabilities would be 4.2 million per annum. It won't be that figure because that's ending up at a growth figure. And what this is to do, and I'm really delighted because actually recommendation A is to scrutinise the budget proposals, and I think this is exactly what we should be looking at. It goes back to Councillor Seif's question. This is a great budget for an accountant because it's quite a management accounting concept in terms of where the number of people you expect, the price you expect, and the longevity or the acuity that you expect. So as accountants, we get really excited by doing this modelling. So that's why we arise based on the current understanding of what we think will happen with all of those factors, demography, price, acuity, longevity of care, and these sorts of factors we will then roll forward based on our assumptions and understanding of today. And absolutely, we're happy to provide all of the committee with a further briefing on those 2 items.
Thank you, Michael. I have 2 more speakers who indicated they wish to speak. So if you still have any burning questions, please message us to indicate now because we're about an hour in debate. So I have Councillor Slatter followed by Councillor Bowden, please. So Councillor Slatter first.
Thank you, Chair. This is more a looking forward contribution. Page 102, I'm just trying to anchor it onto. A fairly flimsy anchor, and that is planning ahead and preventing long-term conditions. I think we need to consider putting in there being proactive when it comes to either planning applications for supported housing of all sorts and not just looking at commissioning beds in for the most frail, and also just generally the co-production of health-related and health and well-being related activities that sometimes are prevented by a simple barrier, sometimes a step, sometimes the lack of publicity, but we're all aware of that in our divisions. I would like us to be more proactive and enable the office to be so, because the County Council's in a brilliant position with its public health training, and they're very holistic if you go do public health. And they've got a very good idea what, for example, supported housing needs, and maybe not able to express it until they find it's not there and it's a bit late. So it's trying to avoid the retrospective fitting out, but also to make the most of co-production. I mean, I'm greatly enthusiastic about the Care Academy, so another cue for there. If you look at the list of courses, Councillor Count, it is fascinating, but I would also like to see in there making the most of a village hall or something like that, because the skills involved in multi-purpose and therefore good value for money are immense, and I'd like us to make the most of that in time for me to be active and happy in even older age.
Thank you, Councillor Slatter. Do any of the officers want to comment on that? In that case, I'll move on to the last speaker, who is Councillor Bowden again, please.
Thank you. You called me the last speaker. We're still on questions, aren't we? We haven't gone on to the debate yet. Oh, good.
I meant the last question, sorry.
Good. thought I'd lost out there. Right. My second question was on the subject of the Learning Disability Partnership and Section 75 agreement. Now, yes, we talk about management accountants liking demography, price acuity and longevity and making our calculations, and I fully understand the calculations. Unfortunately, if some of the assumptions behind those calculations are wrong, then the numbers we end up with are quite a bit out. And we've made an assumption for many years, before this administration came into force, I have to say, about our expectation that the Section 75 agreement would be fixed and that we would make savings in the forthcoming year as a result of the whatever incarnation of the health service was in place at the time, that they would come to their senses and that we would have a revised Section 75 agreement. And unfortunately, year after year, that proved not to be the case. Now, I'm well aware that we have served notice that the Section 75 agreement will be terminated. I very much support the actions which have been taken by officers on that, because you can only be strung along so far, and we were strung along far too long. So that was a quite appropriate thing to do. My first question is, and there's a second part to this, but my first question is just a confirmation that that serving of notice is now final, and we are going to have the termination of the Section 75 agreement. There's no way back now. Even if the health service were to do it at about turn, it's now too late, because my understanding from seeing this report is that we are now working on the assumption that the Section 75 notice, the Section 75 agreement is terminated and just will not carry forward. So that's the first part of my question. And the second is to do with the numbers which are associated with this. Now, we are projecting very significant savings to be made, and I understand where these savings are to be made from, the termination of the Section 75 agreement. But coming back to these comments about demography and price and acuity and longevity, I am concerned about the sensitivity analysis of the savings that we are saying that we're going to be making as a result of the termination of the Section 75 agreement. And to what extent can we be confident that the numbers which have been put in here are realistic? Because I have a feeling, and it's only a feeling, that there's a great deal of uncertainty about the amount of saving that we will actually achieve. And my feeling may be wrong on this, but I'm just concerned about just how confident we are about the numbers we're projecting as a result of the termination of the Section 75 agreement. Thank you, Chairman.
Thank you, Councillor Bowden. Patrick, please.
Yeah, thank you, Chair. So on the notice, so we've served notice as we brought to committee. That's a 12-month notice period as part of the Section 75. That for us, that expires at the end of August this financial year. There's a significant piece of work, and in fact, one of the other papers on committee's agenda today is around additional capacity to get the reviews done of those cases, because we need to get those reviews done in order to confidently end the agreement and agree the financial split between with the ending of the pooled arrangement. So that's in terms of the term of that. Justine, can I come to you on the numbers bit and maybe bring Donna in as well?
So how confident are we in the numbers? I mean, I would say we have gone for a conservative number with a small c, because we don't want to overinflate and find ourselves in a difficult position. The numbers that are based on an analysis of all the packages we've got and the splits that we've got recorded for them, et cetera, et cetera. We're not at a definitive point with that, and there will be discussions with the ICB, there's no doubt about that. So we've tried to be on the cautious side to make sure that we, we've got the best chance of delivering what's in there, but there's a long way to go.
Thank you. Are there any more questions about this, Councillor Bowden?
My apologies, but I just get one thing quite clear. I know that we've given termination notice about the Section 75 agreement for August. Is that irrevocable? Is that something which is going to go ahead regardless of what attitude whether the NHS manages to come to its senses or not? Is it a final done deal?
So we've served notice on the pooled fund, but the Section 75 is around an integrated service as well. Now, the ICB have indicated that they may well, as part of that separation of the pool, they may also want to separate the integrated service. And that's something which we've been very clear we wouldn't want to happen. The integrated service works. It's the financial arrangements which are more challenging. So the financial arrangements, the separation of the financial and the pool budget is something that we want to happen. What we want to really work on is not separating the integrated service. And at the moment, we continue to leave the door open that we can continue to have further conversations with the ICB about maintaining that integrated service. But the pool fund, we want to separate out. So we want to continue with the separation agreement and the termination of the Section 75 on the pooled fund. But on the integrated, we haven't talked about termination of that. The ICB have said they may well want to terminate the integrated model. So the door is open there for us to have further conversations with the ICB on that particular aspect. But on the financial bit, that's where we will continue with our termination.
Councillor Bowden.
May I thank you for that extremely clear explanation of where we are. I find it a bit worrying, and I think we've got some real risks here as far as some of our residents with learning disabilities are concerned. But I think the point you've made has been extremely clear. So thank you very much for that.
Thank you. Councillor Sip is on the same point or a different?
Yes, sorry, very, very quick question, if I can, about process. As you know, this is the first budget that I'm sitting through. So I wanted to ask, and this concerns the granularity of the figures that we're presented with. It's clearly invidious. I mean, his report runs for 100 pages. It would be almost impossible for all of the committee to work through the detailed analysis of these figures. But I just wonder whether, in fact, the chairman and the vice chair normally sees that detail before it comes to us. It's just a matter of process. Or are they presented in their totality by the officers to the committee for, as it were, for the first time?
Thank you. As the replacement chair, I can't comment on that. So, Michael.
Thank you, Chair. So the budget process doesn't start or end with February. The budget process is an ongoing business planning process. So the first part is that officers are continually reviewing. As the Section 151 officer, I have a duty under Section 25 in terms of commenting on the robustness of estimates and the budget proposals. So we're working through every single line with every single officer. Some of that is discharged through the likes of Justine, who I'm internally grateful for. And then there is engagement through chairs and vice chairs, and there may be development of things that have come previously to committee that will see themselves through in terms of this process. But obviously we are running through the entire process with those people.
Thank you.
Thank you. We had over an hour now of questions, so I think we have scrutinized very well the proposals. Does anyone want to debate this item now? So I have Councillor Bowden, please.
Thank you very much indeed. I'll try and be brief, Chair, but thank you for allowing the amount of scrutiny we've had on this very important matter. I continue to have my concerns, some of which I've expressed over many meetings of this committee about a number of items. The first actually comes back in part to the first questions that were raised by Councillor Sif earlier. And he mentioned, he wasn't quite specific about it, he mentioned sexual health, and the real concern there at the moment is gonorrhea. And he also mentioned measles, but the real concern is on the MMR take-up, the underlying problem which exists. And it is things like that where we really do need to take action wherever it is possible to do when a new or relatively new danger emerges or becomes much more serious. And that is where there's the opportunity to utilize public health reserve in a proactive way. And I'm disappointed that we aren't doing that as effectively as we could. Now, I'm sorry to say not a single member of the administration who is present here today was a councillor previously when we were dealing with public health in the previous administration. And that's unfortunate, but at that time we had a very cooperative arrangement in place where all three major political parties took a major part in deciding what we would do, particularly in public health and on the public health reserve. And our Director of Public Health at that time, this just goes to show that just because you cooperate doesn't mean to say you get the right answer. Our Director of Public Health at that time very much encouraged us to make sure that the public health reserve didn't get too high, but did tell us we've always got to keep some of the public health reserve in reserve, because you never know what might happen. And this was before 2019, she said this. You never know what might happen. There could be some form of epidemic on the way, and you'd need that public health reserve. Lo and behold, we get COVID-19, and the actual effect on the public health reserve was to increase it rather than decrease it. And that's because so much of the expenditure to do with COVID-19 came centrally from central government. We didn't need to use our public health reserve at all for that. But additionally, much of our expenditure on public health wasn't able to be achieved because of the pandemic. So our expenditure went down and our reserves actually went up. So far from a pandemic needing a public health reserve, the pandemic actually fed the public health reserve. So it just goes to show that you learn from experience, and the best advice that you get sometimes, and all the good heads coming together, don't necessarily always come to the right answer. But we're still in a position where we are failing to anticipate the spend that we've got in our ring-fenced public health money, which is why the public health reserve isn't disappearing. And I'm not asking for the public health reserve to be zero. That would be a bit dangerous. But when you do have clear dangers, such as the position on gonorrhea and the position on MMR take-up, it really does call, in my opinion, for more resource to be spent from the anticipated reserve that we're continuing to build up, so that those problems are cut off or reduced as much as they reasonably can be. And I have to say, overall, on the population-based public health services, I've expressed my concerns before about how they are operating. I wouldn't do it in the same way as is being done by the administration at the moment. It's a matter of choice at the end of the day. I'd particularly be more interested in reducing health inequalities that we've got within the county than we are doing at the moment. And that's not merely on the public health side, but also the inequalities that are on adults in social care, which we've got between different parts of our area, which is quite inequitable. But at the end of the day, it is for the administration to put their budget forward, and this is part of the budget, and so be it. We'll have to live with it. And as Councillor Count said, you don't need our votes on this side of the room in order to push this through. I am particularly concerned, and a particular thing which would cause me not to be able to support this proposal in front of us today, are the administration's change to the procurement processes, reducing the emphasis on value for money. Now, in some ways, that's above our pay grade, because this is decided by Strategy and Resources. It's decided now by the New Assets and Procurement Committee, but it has its effect both on public health and on adults commissioning. And I believe that effect is really quite negative so far as the finances are concerned. But as I said, the administration has made their choices. We'll all have to live with it, but I just won't be able to support what's before us. Thank you, Chair.
Thank you. Does anyone else want to debate this item? I don't see anyone else indicating. I would just like to mention one thing, perhaps, some members might have touched on this in previous debates. I'm really pleased to see the additional investment in the pay staff, increasing the real living wage. I think we have to think about like cross-committee work and like how these many elements of these proposals fit in the anti-poverty strategy that we debated in the Communities Committee, as well as touching on to the work of Children and Young People Committee. And ultimately, one of the things that I found really interesting is that well, over 86% of residents are concerned about the cost of living, and almost half have actually made a change in their lives, such as limiting heating, food, or medicine, which is really concerning. So I think any kind of initiative to invest in, of course, prevention, in supporting with learning disabilities, mental health, in the time of overall, I'll call them like cuts and austerity in the UK, is like really, really important to prioritize some of our residents' priorities from the quality of life survey as well. So on that note, I don't see any other people any other members wishing to speak. So I would, could I ask now Patrick to actually summarize some of the committee's discussions that will be recorded in the recommendation for the Strategy, Resources and Performance Committee based on some of the questions and the discussion we had earlier. Thank you.
Thank you, Chair. So we've captured the committee sought clarification on any progress related to the announcement by government on the 24th of January 2024 regarding the £500 million for social care. We were noted that we don't have any details. These are not expected until around the 5th of February. The second point was around the level of public health funding to meet the rising demands such as measles. Third point is what the Care Together and Independent Living Services funding was to be spent on, and the detail around Care Together. Officers will provide further updates to spokes and training to this committee on Care Together. The next point was how the older people's pressure investment need was calculated. The process of calculation was explained, including reference to the financial monitoring in 23-24 that committee members have seen related to rising demand. Next point is the vacancy factor and the impact on performance, as well as the impact of the Care Academy. Next point I've captured is how the assumptions around later years pressures had been calculated. Finance colleagues will provide a further briefing to all committee members on that. And the last point we've got is the confidence in the Section 75 assumptions. As a result of the clarification and debate, the committee have not raised any further point to report back to Strategy, Resources and Performance Committee at its meeting on the 30th of January 2024 in their discussion and debate on proposals before they are proposed to full council.
Thank you, Patrick. I think it's an accurate summary of the outcome. And if I can mention like one other thing, I know a few members asked in previous meetings about the charges review as well. I understand that will be like also discussed part of the wider Strategy and Resources Committee.
Thank you, Chair. Yeah, I can personally publicly state that we are committed to doing a review of the adult social care fees and charges. That work, we will define the scope. We will work with the committee chair and the committee around defining the scope. And then we will take some time, probably months, to complete that piece of work. That will involve learning from other authorities, and which we may require legal advice. And what we will do is we will bring back reports through spokes and through the relevant governance arrangements back to this committee if needed on a decision once we've done the findings of that review.
Thank you, Patrick. So this concludes the questions and the debate of this item. So we'll now move to the vote. The report recommendations are as follows. The Adults and Health Committee are asked to A, consider and scrutinize the proposals relevant to this committee within the business and financial plan put forward by the Strategy, Resources and Performance Committee on the 19th of December 2023. B, to recommend changes and or actions for consideration by the Strategy, Resources and Performance Committee at its meeting on the 30th of January 2024 to enable a budget to be proposed to full council on the 13th of February 2024. And C, to receive the fees and charges schedule for this committee included at Appendix 2. So would those in favor raise their hands now, please? Thank you. And those against? Any abstentions? Would the Democratic Services Officer please confirm the result?
So I count that as 8 for and 5 against.
Thank you. Moving on to item 5. This was a very long and robust discussion, but I think it's really important for the scrutiny of the budget proposals. So it was good to have a bit of time on this. So moving on to item 5, which is procurement of an all-age unpaid carers service, which can be found on pages 137, 150 of the agenda pack. Appendix 2 of the report is confidential. Now, if members wish to discuss this appendix, it will be necessary to move this item at the end of the first half of the meeting or at the end of the meeting, at which point we would need to vote to exclude the press and public from the meeting on the grounds of the document containing exempt information under. Apologies, Councillor Goodliff, do you have a point of order?
Not quite point of order, no. I should have realised beforehand I am an unpaid carer and I don't think it's on my declaration of interests.
Okay, thank you. Thank you very much. If anyone has any other declarations of interest, you can do so before the item as well. So continuing this, just to reiterate this, if members wish to discuss this appendix, it will be necessary to move this item at the end of the meeting, at which point we need to vote to exclude the press and public from the meeting on the grounds the document contains exempt information under paragraph 3 of part 1 of Schedule 12A of the Local Government Act 1972 as amended, and that it will not be in the public interest for this information to be disclosed, information in relating to financial or business affairs of any particular person, including the authority holding that information. Do any members wish to discuss Appendix 2? No? Okay, that makes it very simple then. We have Shona Torrance, Head of Adult Social Care Commissioning, and Anne Betts Walker, Commissioning Manager, are here to present this report. So Patrick, would you like to say something first?
I'd just like Will to introduce. This is a paper Chair, that was brought to December committee. There
Okay.
were several questions asked by committee, which we took as an action. They were shared at spokes, but I'd like Will to introduce before we hand over to Anne and Sean.
Okay, that's great. Will.
Yeah, thank you, Chair. Thank you, Patrick. That's exactly what I was going to say. So at risk of saying it again, we brought this paper, you'll recall, to the last committee. There were a number of questions that we were asked to go away and consider, which we have now done, and we've included in the latest report that we bring to you today. I'd propose, Chair, we're happy to go through the paper if that's helpful, or alternatively ask questions.
Sean and Anne, would you like to add anything given this context, or if not, we can move straight to the questions?
No, thank you, Chair.
Okay, thank you. Thank you both. So I'll now open up the report to questions from the committee. Anyone has any further questions? Councillor Sif, please.
Yes, one thing that I learned from the revised paper is that the provider, whoever is selected, will be very much dependent on voluntary labour, and which has considerable benefits, which I do understand. Can I just ask, how do we ensure that the provider is putting in place a program to, first of all, recruit, retain and train those volunteers, and that they are adequate? Because it seems to me this is a very essential service, and if volunteers for whatever reason don't come forward, it's vulnerable. So that is my concern. I'm sure that, as I say, the providers are asked to do this, but how do we ensure that they do so?
Thank you. Who'd like to answer to? Yes, please.
Thank you. So I can confirm the service is set up it's a combination of a permanent staffing workforce and a volunteer base. In terms of how we assure ourselves that the service is able to deliver with that staffing base, there's a contract monitoring regime in place. So we regularly monitor that provider, and we have detailed conversations with that provider on a regular basis where they raise any risks with us, and we work with them to resolve those risks where they arise. Recruitment and retention of staff is very much fundamental to the framework we use to do that.
Thank you. Councillor Sif.
Yeah, both the permanent staffing base and volunteers will be subject to that.
So I just want to say you didn't have your microphone on, so the live stream didn't capture that, but thank you. We did hear it. Councillor Black, please.
Thank you, Chair. And I'd like to thank the officers for coming back to us. I mean, I felt when we first saw this paper, we had not had much chance to consider things. And one of the points that I really wanted to get across is that as an administration, we want to see insourcing. We want to see the voluntary sector in its correct place. And there were all sorts of worries about this particular tendering process. And I think there are explanations that it seems to me this is perhaps not the contract that we would most be worrying about insourcing, but I hope that we are, will we see in future much more attention given to insourcing and see some evidence of properly exploring that. And I take on board that this is a contract which deals with volunteers, and the use of volunteers by the people doing the contract has some appropriateness of it. And I don't want this to go into the private session for the information we've got, but I suppose we must think about, when we're thinking about the overall direction we want things to go, the disparity between the sort of wages and conditions and things like pensions that you get in a council contract and what you might expect from the voluntary sector. And also, clearly in the whole system of set up here, not enough thought is given to the disparity which exists between private profit-making businesses as well. Now, I'm looking at this contract, and clearly we've got to vote for the tender to go ahead. I hope that we are going to see the voluntary sector win the tenders. And so Yeah, I'm sorry, I'm trying to fashion this into a question now, but thanks for bringing back the information we have. But please, can officers take on board that when these contracts come up in future, we'd like to have much more, I think, advanced warning of it and an input to identify where we can insource things and perhaps get rid of the profit element and use that towards the workforce and to the services provided. Thank you.
Thank you, Councillor Black. Will.
Thank you, Chair. Thank you, Councillor Black. I'll just respond as best I can to those points that you raised. On this specific service, we did look at the opportunity to bring the service in-house. And there were three key issues around us doing that, hence the recommendation not to, and they were based around value for money, our capacity and capability. But interestingly, as part of recommissioning the service, we co-produced a lot of co-produced the requirements around the service with carers themselves, and there was very clear feedback from the people who use the service that their preference would be that it was not delivered by the local authority. In terms of getting earlier sight of services that we intend to recommission, we were asked to produce a forward plan of our procurements, which we've done and we shared with Spokes, and that looks forward for the next 3 years. And it is our intention as part of that feedback to bring those potential services that we are intending to recommission back to committee earlier than we have been. And then in terms of in-house, don't want to go back to the business planning paper particularly, but within that there is an initiative to look at our in-house services and a review, and part of that will be looking at opportunities to bring services in-house. And then also within the business planning paper, you would note that there is actually a service that we are planning to bring back in-house, just in answer to the wages issue that you raised, which is the trusted assessor model, which we do plan to bring back in-house. So it's not necessarily always about wages. I just thought it's important to clarify that.
Thank you, Will. I have Councillor Dondon next, please.
Yes, thank you. It's really a comment, not a question. And I'm so pleased to see, and again, I know this is the second time round, but really so pleased to see the additions to the specification mentioned on page 142, and particularly increasing support for adult carers caring for people with Alzheimer's. It's devastating for all concerned, and people looking after adults with Alzheimer's. Any additional help, both physical and mental support, I think is really to be welcomed.
Thank you, Councillor Dondon. Councillor Hay, please.
Thank you, Chair. I just wanted to know, once these contracts have been awarded, what oversight do we as a local authority have to ensure that we are getting value for money and that the contract is running as we would wish it to?
Thank you. Would like to take this question? Shona, please.
Thank you. So similar response, really. So as part of the mobilisation and delivery of that contract, we will work with the provider to agree a set of performance metrics. So on a regular basis, we will receive those performance metrics, and that allows us to look at how the service is performing in the key areas and delivering against the key priorities of that service. In addition to that, we have officers that go out and visit the service and monitor the service to make sure that the feedback we're getting is reflective of the service being delivered to people on the ground. And then there is a more high-level meeting that will happen on a regular basis against the key changes of the contract to make sure they're being delivered, to sum up the experience of the monitoring officer and bring it all together. And if we have any concerns around that or the providers raising any risks, we'll put an action plan to ensure that's addressed.
Thank you, Shona. Does anyone have any other? Anne? Yeah.
Just to add to that second point, we do ask for an independent evaluation to be done in probably year 3 of the contract, which is completely separate from us, and then we receive that report. This most recent one was done by the charity fundraising organisation, and we received that report 6 months ago. So that actually also independently reviews the sort of outcomes that we're asking from the providers for us as a sort of third party.
Thank you, Anne.
Thank you for that. That puts my mind.
Thank you. Councillor Slatter, please.
Yes, and thank you, Councillor Hay, for bringing that up. It reminds me that there's quite a scope for duplication of effort by officers in this, because sometimes organisations are receiving grants from district councils and from the county council. I'm sure that there's a good network of local officers who talk to one another, and hopefully may well share their concerns if there are shortcomings. But it's obviously important that we don't have duplication of effort in that monitoring, and sometimes the district councils have some very good local knowledge, and sometimes the county councils have some good shared good practice, and I'm confident that that's the issue, but this is one thing councillors look out for. Thank you.
Thank you, Councillor Slatter. I see no other comments or questions, so I'll now move on to the report recommendation. So the Adults and Health Committee is being asked to approve the procurement approach and the overall value of 6,315,616 based on 2023-2024 values over 3 years, plus a 12-month extension period of the all-age care service, and B, to delegate responsibility for awarding and executing contracts for the provision of the all-age care service to the Executive Director, Adults Health and Commissioning, in consultation with the Chair and Vice Chair of the Adults and Health Committee. Can I have all those? Actually, it does seem here, just seems there's a general consensus, which is nice for the recommendations. And I see no objections unless anyone indicates now. In that case, we are passing this, we are taking those recommendations as carried. Thank you very much for all your comments, and thank you to the officers for presenting this report. So now we move to item 6 on the agenda, which is titled Procuring Additional Adult Social Care Reassessment Capacity. This is on pages 151 to 166 of the agenda pack. I will now ask Gurdev Singh, Head of Service, Commercial Contracts and Brokerage, to present this report. So Gurdev, over to you. Thank you.
Thank you, Chair. So this report is for the procurement of additional capacity. This will help us to complete some reassessment work that we are already undertaking, where we have more to be done. I'll draw members' attention to paragraph 2.8, which describes that this is also something that's been highlighted at our recent LGA peer review in preparation of the CQC assurance work that may take place later this year. And the results of this work will complement the recruitment activity and the in-house activities already taking place. We've already talked a little bit about earlier in the debates today about the vacancy factor and the vacancy element, so I won't repeat those sorts of points. I also like to draw committee's attention to paragraph 3.2, which describes the activities to be undertaken, and paragraph 3.3, which talks about the approach we will take, which primarily starts with recruiting through our partners Opus in the first instance, and if that is not successful, then we would look for a full procurement process. And then finally, paragraph 3.4 explains the funding that we've allocated for this piece of work in order to complete the task in hand, and the options that we considered as being not appropriate are set out in section 4. Thank you, Chair.
Thank you for the report. I will now open up the report to questions from the committee. Councillor Black, please.
Just a very quick one to start with. I think I heard paragraph 2.8. I can't find that. It only goes up to 2.5.
Clarification on that, please.
I beg your pardon, I should have said 2.4. That version of 2.8.
Okay, do you have a question, Councillor Black, or that was just for clarification? Yes, okay. Councillor Sif, please.
Yes, also a quick question. 100 more members of staff or agency staff, can you find them? And do they have the skills to do this sort of work very quickly?
So we're not asking for 100 members of staff. This piece of work will be carried out over the next 12 months. It'll be a smaller group continuing that work. So it's equivalent to about 1,000 pieces of work, but spread over about a year.
Question still remains, can you find the resource to do this? And if you're bringing people from outside, will they have the skills?
So if I just break that down a little bit more, it's approximately 100-ish per month of activity, which is about 25 per week. So we're looking for a number of additional resources, less than 25 in total. And that therefore is a more manageable target to try and find through the marketplace.
Thank you. Apologies, Councillor Black. I thought your question was the clarification question, so please have your question.
Yes, thanks very much, Chair. I just wanted Jeff to go first, so I had a chance to read the paragraph that had been referred to. So yes, I had been wanting to ask a question on this because, again, I've been saying we want to take the administration's ambitions to insource things seriously, and here I think we have, in contrast to the previous item, we have something which really, ideally, should be done in-house, and I think. Hopefully we are agreed around the table that it should be done in-house. And so I acknowledge what officers are saying about they're doing their very, very best to recruit people in-house to do this work. And I mean, there are things about, I suppose, public sector pay and attractiveness, so on, that feed into this. So, I mean, what I'd like to ask is, I think we've got to have an acknowledgement that we can't go on like this. I mean, we're extending this for a year, but I hope this is a one-off, that we're not going to have contracts like this coming back again and again. Because really, when it comes to recruiting staff in-house, we really should be making sure that does succeed. Because when you get agency staff in this is the least efficient way of doing it. I mean, we are talking about hiring a company which will take a large slice off the top, who I suspect may well pay people to do the work that would get less money than the council officers actually do, or certainly if you look at their package as a whole. And and my comment is, well, this is not the way that this sort of work should be done, and we should have an ambition to not be carrying on in this way in the future. Thanks very much.
Thank you, Councillor Black. Gurdip, over to you.
Thank you, Chair. I think there's probably two particular points I just want to draw out that probably describes why this is a requirement now. One is that we have an impending CQC inspection due, and it was something pointed out by the peer review that there is a noticeable backlog, and they would like to see improvements to reduce that backlog. That's the first thing. So there's a timing issue there. And secondly, something that Patrick mentioned earlier about the work we're doing with the ICB, and we have a target to try and complete a certain amount of activity before August to improve the accuracy of the information we have, and therefore our work with them when it comes to the determination work. So there's a capacity and a timing issue that's now that makes it harder for us to just rely on just our existing workforce.
Thank you. Councillor Slatter, please.
Thank you. I am again but concerned about duplication of effort. A lot of these people will be being looked after by carers, and they're part of an agency, and they will have reviews, because certainly in case of long-term or conditions like being mortal, and therefore old age never makes you feel better, there will be changes coming from somebody, a decline, sometimes a very sudden change, sometimes a bereavement in the family, or a disappearance of a carer can make a big difference. We know there's lots of different reasons for a reassessment, and you've outlined some of them. Now, I just hope we are capturing as much as possible from the people who do the day-to-day caring, both paid and unpaid, to make sure that that we are not expecting people from outside to suddenly see all the important things, because we know a lot of people pretend to be better than they are when they're being assessed. And it's very easy to be fooled. I think we can all think of personal experience of that. Well, I just pause, right? And that sort of thing, seriously, are we able to build into these contracts that the person taking on the contract is given full access to the people who've already got some of the answers as to whether somebody has crossed over from ordinary social care to nursing care, whether their personal care needs mean that we need to be moving in with more money or more actual practical help. That's the element of it that I'm most concerned about, Mr. Singh.
Thank you, Councillor Slater. I believe Donna would like to come in on this question. Thank you.
Thank you. I'll answer that one because it's a more practice-related question. So these people who are brought in to support us with this are embedded in our team, so they have access to the same records that our permanent staff do, and also to the wider team. And we go to quite some lengths to make sure that embedding happens well, and it has worked well so far. This additional activity helps us to meet our Care Act responsibilities. So we as a local authority must review people at least annually. There are people, as you quite rightly say, who know them much better than we do. And in all reviews, including those taken by people who are with us temporarily, we involve the person, the people that know them best, and any other professionals who've been heavily involved through the preceding year in the review. So you can rest assured they follow the same practice model and they work as quality assured through the same quality assurance processes as all of our workers.
Thank you. I do not see any other questions. So, my apologies, Councillor Hay.
Thank you, Chair. At the time of this report being written, it tells us that there was 2,000 care assessments and reviews to be completed, which was made up of 700 backlog assessments and 1,300 scheduled reviews where there is capacity shortfall. Do you have an average time over and above which people are waiting for these assessments, over and above the natural timescale that we would expect them to wait? And do you have any idea when we will be fully up to date with these assessments?
Thank you. Gurdeep, would you like to respond to this one?
So the short answer, I don't have an average time above what people would normally wait. And in terms of when might we complete all the assessments, it is a little bit of a moving feast because there are more assessments being added each time. And some assessments take longer simply because there are more issues to resolve. And thirdly, some of those assessments, particularly this cohort of assessments we're looking at, involve partners such as the health system. So it almost links back to the first question about the average time, but it's something I could probably take away and try and do some more work on.
Thank you. I see no more questions. Does anyone want to debate this item at all? No, in that case, I'll move on to the report recommendation. It states in the event we cannot hire interim staff as per paragraph 2.4, Adults and Health Committee is recommended to delegate responsibility for awarding any contracts for the provision of adult social care reassessment work commencing March 2024 to the Executive Director of Adults Health and Commissioning. B, delegate responsibility for executing any contracts for the provision of adult social care reassessment work starting middle of March 2024 to the Executive Director of Adults Health and Commissioning. And C, this work has an estimated contract value of 1,180,000 over the next 12 months. So there seems to be a general consensus in support of the recommendations. So I will take that as carried unanimously unless anyone indicates no. Okay, that is then carried. Thank you very much. I am minded to take a 10-minute break now before item 7 because I can't really estimate how long the debate will take on that one, if that is okay with everyone here. And then we can come back at maybe 5 to 4 p.m. to resume the other, I think 4 or 5 items we have on the agenda. Thank you very much. We'll see each other back here in 10 minutes. Thank you. Okay, thank you, members. I'll start on I'll continue with item 7. Again, I know a couple of colleagues are still probably waiting for the coffee, but I'm not sure how long that will take. So I'll move on to item 7 so we keep ourselves on time for this committee. And the item 7 is the titled Referral from Audit and Accounts Committee on pages 167 to 172 of the agenda pack. The committee will note that there was an amendment on the report recommendations that has been put forward by Councillor Richard Howitt, the chair of this committee. Now, Councillor Howitt is absent today, and I don't believe there is a proposer for this amendment unless anyone wants to indicate otherwise. In this case, because we don't have a proposal for the amendment, we can't take the amendment if no one is going to propose it. So we'll move on straight to the report presentation and then the questions. So we have Mairead Claydon, Head of Internal Audit. She's online, so welcoming Mairead online, Head of Internal Audit and Risk Management, who is here to present this report. So Mairead, over to you. Thank you.
Thank you very much, Chair. So this paper presents a referral to the Adults and Health Committee from the Audit and Accounts Committee. When the Audit and Accounts Committee met on the 1st of December, they wished to refer this update on contract management of the Healthy Child Programme and the Integrated Drugs and Alcohol System contract from an internal audit progress report for the awareness of the Adults and Health Committee. So the full text of the matter, which was before the Audit and Accounts Committee, is incorporated in your report at section 2.2, and it relates to 2 audit actions agreed by the Public Health Directorate, which are currently outstanding for implementation. So the audits of the Healthy Child Programme and Integrated Drug and Alcohol System contracts, internal audit noted that in both instances, the terms of the contract included a right for open book contract monitoring, but that this had not been implemented at the time of the audit. Actions were therefore agreed to implement an open book approach to contract management, which reflects the terms of the contract documents, as well as sit for best practice and NHS England guidance for integrated care systems contracting. So the text that has been referred to you is an update on the implementation of these actions, which was received from the Director of Public Health in November, and that reflects a revised target date for implementation of 30th of April 2024. That reflects the need for officers to undertake training in open book contract management, as well as for the commissioners of these 2 contracts to identify an appropriate approach to open book review for each individual contract. The Audit and Accounts Committee felt that this update should be shared with the Adults and Health Committee to ensure their awareness of audit actions and progress with implementation.
Thank you, Mairead. Just to add before I take any questions about this report, given some of the discussions that have been had before about the amendment, which we're not taking today, I would like just for officers to ensure perhaps that public health officers have the capacity and skills to actually carry out open book accounting, and we're of course learning from the experiences of this work within the NHS, which is already taking place in adults and children, for example, with occupational therapy contracts. I'm not sure if Mairead or anyone else would like to reassure the committee on this point. Or who would like to, or Jyoti, would you like to come in on this point?
So
Thank you.
we've worked with Mairead and her team to agree a way forward that is acceptable and deliverable. So I'm content with the recommendations that we will meet the requirements by the end of April. Thanks.
Thank you, Jyoti. Are there any questions on this? Councillor Bowden, please.
A question first before making any comments. Could we just be reminded, please, about the value, the annual value of the Healthy Child Programme contract and the annual value of the Integrated Drug and Alcohol contract approximately, and when the current contracts actually commenced?
Thank you. Who'd like to take this question? Okay, we'll take another question whilst the Val would like to come in on this point. Thank you.
The annual value of the Healthy Child Programme is between 8 and 9 million, and for the drugs and alcohol, it's a little bit different. Normally it would be around 4.5, but it's been inflated by the additional grants from the centre. The Healthy Child Programme contract, well, it's due for, it will end March 25, and I think it was Section 5 in 2020, and the drugs contract goes back to 2018 or 19, because we extended it, and I think it's 19.
Thank you, Val. Councillor Black, did you have a question or someone indicated on that point, but I don't have it on my speakers list, so did it indicate? No, okay. In that case, would like to come back on this, Councillor Bowden? Okay. No more questions. Okay, that is a very short debate. What is it? Not debate, a very short Q&A. Yes, okay, so you want to come in the debate.
Yes,
all right,
please.
Perfect, Councillor Bowden. So now we open the debate and starting with Councillor Bowden. Thank you.
Thank you very much indeed. Many members of this committee may not be aware that for more than a year, there have been concerns raised by our internal audit function that these two large contracts, we've just heard the value of them in the Public Health Directorate, have not been subject to the steps necessary to implement the open book contract management provisions, which were included at our insistence, I assume, in these two existing contracts. Now, open book accounting is might sound rather technical, but the principle behind it is very simple indeed, and that is that there are occasions when one or other of the contracting parties in a contract feel the need to have greater visibility, greater transparency of the costs behind the contract, so those costs are made more public, more available to the other party. And very often it's very often it's a matter of agreeing that a certain percentage of on cost will be allowed for profit, and but the costs which are actually incurred will be visible to the contracting party, which is placing the contract. It's not an unusual form of contract. It doesn't happen quite so much in the private sector, but it is quite frequent. I've certainly heard a lot in the last 40 years on both sides of the table. But in the public sector, it is rather more common because there should be rather more trust in the public sector and ability to transfer data. And in fact, so far as open book accounting is concerned, NHS England make it quite clear that they expect the NHS to facilitate open book accounting with their partners, including local government, when dealing with both health and social care matters. And the same goes on our side. CIPFA say that that open book accounting represents best practice in managing major public contracts to maximize the value which is obtained. So it's not unusual, but the way in which it's done, it can be done in myriad ways. I know we've got accountants on both sides of the room today. So for some people, this is extremely obvious. Other people may not have come across it so much before. But this can be done in all sorts of ways, from having an examination of every single transaction which takes place, to taking a statistically valid sample of the transactions and testing those to ensure that they comply with the contract terms. And that I personally prefer that statistically valid sample to be a random one, but there are also non-random sampling techniques which are available to be used to reduce the size of the samples even further. And it's amazing, even where you have a very large population size, you can get a high level of assurance from a remarkably small number of transactions that the processes are going through properly. And as I say, this is not rocket science as far as accountants are concerned. This has been going on for decades. However, this got to the stage in internal audit where it was by far and away the most outstanding item which there had been for the longest period of time and with the greatest severity in the reports which were coming to the Audit and Accounts Committee. And we received it on more than one occasion in Audit and Accounts last year. And I have to pay tribute to Councillor Graham Wilson, Councillor Nick Gay, that they do make sure that the Audit and Accounts Committee works in a non-partisan way for the interests of the council as a whole. And that is an entirely appropriate thing to do in an Audit and Accounts Committee, but I can tell you I've seen a number of Audit and Accounts Committees in my time which don't do that. But they do this absolutely straight down the line in the interests of the council, and they don't let party politics get in the way, which is good. And when we had our meeting of audit and accounts on the 1st of December, and this matter came up yet again before us, having already missed previous deadlines, and we saw that a new deadline had been put in for the 30th of April 2024, we thought that it really was important that this is brought before this committee, because we're the ones who've got responsibility at the end of the day. It's not audit and accounts, it's our committee. And the number of missed deadlines, missed opportunities to move this forwards did concern the whole committee. It was a unanimous decision of the committee to bring this forward. And it's a really unusual process. Certainly in the 10 years that I've been a county councillor, I don't remember a single time when the Audit and Accounts Committee have felt it necessary to refer a matter such as this to a relevant service committee for their consideration. So that's the seriousness of it. And I'm delighted that we have the opportunity here just to debate it and to talk about it. We haven't got a proposal now in front of us, which is good, because more than anything else, it's important that this latest deadline of the 30th of April 2024 is actually met. We can't change the past, we can't change what has happened in the past, but we must make sure that we don't have yet another failure to meet a proposed deadline for the resolution of this matter. Now, this matter didn't come before the first available meeting of the Adults and Health Committee, our last one, but has been brought before this committee. And this debate which we're having now and will have is exactly what I wanted and expected, and I believe which is necessary. But I have to say that I was really concerned when I saw the amendment which had been brought forward by the chair of the Adults and Health Committee. And that amendment basically said, oh, until open book accounting is available for everyone in the whole of the county council in all our functions, then we shouldn't be doing it as just specifically in public health. And that missed the point entirely of the importance of it, the reason for it being in place, and the urgency of ensuring that we are getting value for money in these very large contracts that we've got. And these two contracts combined account for pretty much half of the total amount of money that we spend in public health. So it's not insignificant at all. Now, I have to say that I thought that given the concerns raised by our internal auditor, that proposed amendment was really unhelpful. So I'm very pleased, Chair, that you have not found anyone to propose that amendment today, and I hope that it suitably dies a death, because it's really important. I know that we as a council really do have to achieve value for money, even if the money concerned is ring-fenced for public health and isn't a risk to our general reserve. But I think I'd go slightly further than that and say that as these are ring-fenced monies that we're managing locally on behalf of what was Public Health England, now it's either the UK Health Security Agency or the Office for Health Improvement and Disparities. I've never got my head around that. But given that we are spending this money on their behalf, and this amounts to the best part of half of that money every year, we've got, I think, a really specific obligation to follow CIPFA guidance and NHS required practice, NHS England required practice, in ensuring that we obtain value for money in the expenditure that we're incurring on our funders' behalf through this ring-fenced grant. So the assurance that I'm hoping that we're going to get today, that 30th of April 2024 deadline is actually going to be met this time, it will be very, very welcome indeed. I'm not looking for changes to take place in the past, because it's impossible to change the past. But when we are in a position to be able to move forwards, then I think that being able to institute open book accounting and an open book management style at whatever level is appropriate would be helpful. Now, given the population size of the data which would be involved in this on an annual basis, it would be both impractical and unnecessary to do a 100% check on all transactions which take place. So I'll be perfectly happy to see a statistically valid sample being taken, and for us to be checking to make sure that the contract is actually being carried out, or the two contracts are being carried out in the way in which they should be, protecting the value for money that we should be looking after so far as these two contracts are concerned. And I've got no reason to believe that's not the case. But the point is, we should be stronger than that. We should be able to say we've got a high degree of confidence that these two high-value contracts are being managed in an appropriate way. So sorry to talk about some technicalities about the way in which open book accounting can work, but I believe that it's a really important matter. I'm pleased that this committee has had a chance to hear that there has been an issue here. I will also be pleased, I hope, by the end of this debate to hear that this matter is going to be resolved and resolved as speedily as possible. Thank you very much indeed, Chair.
Thank you, Councillor Bowden, for that very detailed intervention. I can see you're very passionate about this this topic, and I think it's fair to say that everyone on this committee does support the open book accounting in line of the the council's existing practice. And just to remind, if any other members want to come into the debate, we're not debating the amendment or the merits or non-merits of the amendment because it is not proposed. So we're just having a discussion now, debate on what the report actually says, which is asking us to consider the matter referred by the Adults and Accounts Committee. Does anyone else have any other comments? We have three. Councillor Sif first, please.
Thank you, Chair. I just want to endorse very eloquent explanation of open book accounting by Councillor Bowden. It was a very long debate that we had at Audit and Accounts. These contracts have been on the agenda for a long time, and there hadn't been. I don't know very much about them. They occurred before my time, but they should be looked at clearly. If we have concerns in the future, it's always the right of the public sector to investigate and make inquiries. But it seems perfectly reasonable that these terms should be included in contracts, and we should invoke them when we can. But I agree and totally that these particular contracts should be covered by this provision. So I very much support the proposals. Well, we supported them, sorry, in Audit and Accounts. There is no amendment. We should note them and act accordingly. Thank you.
Thank you. Indeed, thank you, Councillor Sif. Indeed, the recommendation is to just consider the matter rather than voting for or against something or debating indeed the amendment that's not being proposed. Councillor Count, please.
Yeah, thank you, Chair. Specifically, I want to talk about something. First of all, it's in the actual paperwork, and it says this is, I'm just quoting here, specifically within the health and care sector under NHS England guidance, integrated care systems are required. Well, pop up just covered the screen. Excuse me. Integrated care systems are required to have in place a system collaboration and financial management agreement, which requires open book accounting and financial transparency between its partner organisation. So the word required and requires happens twice. So I was therefore quite surprised at reading the extensive comments for why it hadn't been done yet. The first recommendation for conclusion, not for start, was January 23, and the second was June 2023. And those were implementation dates, not start dates. Now, many of you may not be aware that at one point in time, I was the chair of the Audit and Accounts Committee. It was quite an unusual system where I was a portfolio holder. I was cabinet member for resources and performance, and I was assigned the chairing of Audit and Accounts, and I was quite a new councillor back then. And having gone through that history of accounting, I learned something about recommendations. And the point I want to make here is implementation dates don't come from Audit and Accounts out of thin air. They generally discuss the issue with the director, the directorate that's involved, and they agree a reasonable target. So these shouldn't have been plucked out of thin air, but these should have been reasonable targets which weren't hit. So I was quite disappointed that they weren't hit. The other thing that I discovered as being the chair of Audit and Accounts during that period of time was it was not wise to be in charge of things and to be your own examiner, so to speak. So when we went from noble control to conservative control, the one thing that the Conservative group insisted upon for many years was actually that the chair of Audit and Accounts was always from the opposition. It's something that I regret now, but I've got to say, it's best to be non-political, and Graham Wilson and the members of the Audit and Accounts, I do believe, are doing a terrific job of that. So I really appreciate the way that they've been handling that and not cozying up to the fact that they're in charge and we're not. So I appreciate that. With regards to the amendment that didn't arrive or didn't get moved, it was, in my opinion, unhelpful. I think is the politest way that can be put. But if going back to the days when I used to be in charge, I wouldn't have had this recommendation in front of us. There was an opportunity for me to consider an amendment, and I would have had a recommendation much stronger. This is the Adults and Health Committee. It's our money that's being spent, and I would have put in a recommendation that says every effort must be made to hit this date, no excuses, etc. But I think just from the language of the people in the room today, that we're going to be, it's sufficient that the message is clear, that we believe in open book accounting, there is guidance for us to follow, and there is an agreement to achieve there. So it won't be necessary to have that amendment. Yeah, thank you for listening to me, and just try to add some detail in there. And I really do think that this time, as a previous chair of audit and accounts, there was nothing worse than having to have somebody back in front of you not doing what was an improvement to the overall productivity of the council. So thank you, Chair.
Thank you, Councillor Count. Councillor Black, I hope you're not also debating the amendment, please.
Thank you very much, Chair. I'll stick to my brief as the Councillor Count has. I'd like to thank Councillor Bowden because the explanation he's given about the statistics does clear up some of the worries that had been expressed and possibly been expressed by the people with these contracts. And I think since we first saw this amendment, we've heard from officers, and the consensus, we've got a consensus, I think, that what's been asked here is possible and deliverable from officers, and that's going to be what happens. And so hopefully we're all getting what we want from this. And I think thanks to Councillor Count for the suggestion that the opposition might have a leading role on that committee. I mean, I think that's something we might want to return to in a couple of years' time. It's sounds quite a helpful select suggestion, which I certainly wouldn't ever sort of dismiss out of hand. I think, again, there's a certain consensus here. I think we're all are in favour of open book accounting, and the amendment certainly was never intended to be against open book accounting, and that is the what we are looking forward to have. And I think it rose from a sort of feeling of why pick on public health? Why is it just public health that we feel is the one? And why would there be implementation dates for public health which go on a different time scale for what we're looking to do over all of the contractors of the authorities? And just so sort of to put it in proportion, my thought was I was thinking, well, these look to be some of the most reputable contractors we have. And I think, why are we making such fuss about these particular contractors when they look to me perhaps the contractors least likely to be extracting excessive profits from their contracts and least likely to be ultimately owned by somebody registered in the Cayman Islands or and switching money between different companies in ways that you simply can't follow where all the money's gone and so on. So for proportion, I think open book accounting is a great thing, and I think it's something that may be a tool which is highly necessary when it comes to the council policing its contracts and getting best value for money. So thanks for people, which I think this has been a constructive debate, and we have a way forward that we're going to agree on. Thank you.
Thank you, Councillor Black. So we had at least 3 interventions debating the amendment that's not being proposed as an amendment. So that is just to remind members that all we are asked to do on this paper is just to consider this matter referred by Audit and Accounts Committee in this committee, and not to vote for or against or debate the merits of the amendment. But I have to say, like, one point, that emerged from the discussion on the amendment that wasn't proposed is that we need to ensure we have, of course, the capacity and the skills in the council to actually implement those practices of open book accounting that we are all supportive of in this committee. So does anyone else have any further points for this debate? Definitely not on the amendment. Okay, in that case, I'll move to the recommendation of the report. So the Adults and Health Committee is to consider the matter referred by the Audit and Accounts Committee, full stop. So that's where it stops. And I see there's consensus around the room for this. So in that case, we do not need a vote on this item, and I'll move on to item 8. Item 8 on the agenda is the Adults Corporate Performance Report, which is on pages 173 to 108 of the agenda pack. Appy Reddy, Performance Lead, joins us to present
the report. So over to you for the report presentation. Thank you.
Thank you, Chair.
Apologies, Patrick, would you like to
Yeah.
say something about introduction?
Thank you,
Sorry.
Chair. Yeah. For those that know Appy, you'll realise that that's not Appy sat there. This is Sarah. Sarah started at the beginning of January in the head of performance role within the team. Appy, who's been covering the role on interim, is on annual leave at the moment. So Sarah's stepping in. She's new. She's not new to Cambridgeshire, but she's new to the role. So she's easing herself gently by presenting to committee the performance paper for Q2. This was an item that was deferred from the December committee. So I'll let Sarah present, and then myself and colleagues are here to answer any questions. Thank you.
Thank you, Patrick, and welcome to the committee. Sarah, over to you.
Thank you very much, Chair. Good afternoon, committee. The report provides one of the regular updates that we provide to the committee on the set of performance indicators for adult social care, which is overseen by Adults and Health Committee. The report shows performance and trends over time, as well as comparisons to national and regional data, and that's shown against each of the indicators contained in the report. The report will show the activity and performance up to September 2023. As Patrick mentioned, this was deferred from the December committee, so provides an overview of the first 2 quarters of the financial year. I'm happy to take any questions on the content of the report. Thank you.
Thank you. I'll now open up to questions from the committee. Councillor Bowden, please.
Thank you very much indeed. I have a question on paragraph 2.2.11, indicator 229, which is the indicator which shows the percentage of cases where a risk had been identified, but which did or did not result in any action being taken to reduce that risk. And I was concerned to see that that percentage has worsened. And now we're in a situation where more than 1 in 9 of the cases which are brought to our attention, where we identify that there is a risk, did not result in any reduction or elimination of that risk. And that figure now is quite a lot below the national average. So I would like some assurance that some action is being taken to try and improve that. But we are told in paragraph 2.2.11 that safeguarding pathways are being revisited to increase the number of section 42s to give further considerations to risks. And I'm afraid I had no idea what section 42s were. And I wonder if some explanation can be given of the amelioratory action, which it appears we're being told is taking place in paragraph 2.2.11. Thank you.
Thank you, Councillor Bowden. I believe Kirsten will come to that question. Thank you.
Thank you, Councillor Bowden. So our section 42 is our duty to make inquiries around adult safeguarding. So that's what that relates to. So that's our statutory duty. So there's a significant piece of work, Councillor Bowden, being undertaken around our improvement plan for safeguarding, which includes our multi-agency safeguarding hub and all activity that's undertaken throughout our adult social care system. So it's not just bespoke to the MASH. In relation to 2.2.11, so yes, the performance figure has reduced. We've done a deep dive into those cases, and obviously you can appreciate that we can't always reduce all safeguarding risks for individuals because of choice and control. So we are looking through those cases like religiously, a case at a time, and we're taking the actions going forward.
Thank you, Councillor Bowden.
Thank you, Chair, but that doesn't explain why our number is decreasing, why the percentage is decreasing. Why should that be changing in a negative way, and why we are falling behind, significantly behind, in fact, the national average as far as reducing risk is concerned?
Kirsten would like to come back to that. Thank you.
So I don't have all the data to answer that question today. I'm literally in the process of doing all those inquiries. If I could bring that back, if I could be given a bit more time, I can do, but I can't do that right now because I'm literally in the middle of the investigations.
I'd be more than happy for that to be brought back to a future member of this meeting of this committee. But may I just point out at this stage, I have had more than one occasion in the recent past to contact our safeguarding people within the county, and every single time I've had contact with them, I've had an exemplary service, and we've had really good results. So I do want to put that on record. Thank you.
Thank you. It's good to have some positive comments as well. Thank you very much for that. Councillor Hay, please.
Thank you, Chair. I got rather confused when I was looking through some of these graphs. In Q1 performance report on page 187, it's indicator 230, number of new client contacts for adult social care per 100,000. It says the current quarter is 1,060.9. The previous quarter is 4,560.4. But what it's actually comparing is just one quarter in 23-24 and the cumulative total for the whole year in the previous year. I found that very unhelpful because there was nothing close by that could tell me that's why it was such a large difference. It wasn't till I got to page 200, which is Q2 figures for the same indicator, where it gone, previous quarter was 14.1, which it was in Q1, 23-24, and it gone up to 27.9. That made sense, but where it goes from one year to the next, you should have some explanation right next to those figures explaining that's the case.
Yeah, thank you, Chair. That noted. We will make sure we address the performance report, so that's quite clear that when it's comparing a quarter against an annual year, you can clearly see that as the author. But you don't have to go into the detail to find out. Thank you.
Thank you. Councillor Danton, please.
Thank you. I'd like to ask a question about indicator 140. On the commentary, it mentions that the proportion of people not requiring long-term support remains high compared to the national and statistical neighbour average. So do we know that that remains high? And I find the indicator description really quite difficult to unpack. So if you could just educate me and just talk me through the indicator description, and then perhaps answer the specific question on the comparison with the national and statistical neighbour average.
Thank you. Sarah?
Thank you, Councillor. I'm just trying to find the indicator description. So this, if I'm right, is indicator 140, which is the proportion of people receiving reablement who did not require long-term support after reablement was completed. So people will receive reablement service after a period of time in hospital to get them back to being able to function independently. And the indicator shows that after that period of reablement, they don't go on to require longer term support from adult social care or other services. So we'd like the percentage to be as high as possible so that those people receive one intervention and then that they don't go on to require longer term support. So our performance is high and remains high against both national and regional comparators as well.
Thank you. Councillor Danton?
And do we know why that is?
I'd like to say an effective reablement service is the reason why. And our reablement teams work really, really hard to ensure that they're putting in all the right interventions and being really focused about the work that will support people to continue to be as independent as possible after that period of reablement ends.
Yeah, just one final thing. Just to plead, if you go away and if you're not sort of directly involved on a day-to-day basis on this service, if you just read the indicator description, it's quite complicated.
Absolutely, yeah. We will review the report going forward to make sure that there's some clarity around some of those indicators as well.
Thank you, Sarah. Councillor Count, please.
Thank you, Chair. My concern's more of a general one. I mean, the whole purpose of performance indicators. You know, we have the performance indicator, and then it's quite often that we set KPIs, key performance indicators. So we try and measure and target ourselves. And when we look at 2.1, the first page of this, we have 11 performance indicators, and 0 of them, 100% of them, do not have KPIs. And I just find that not really very good. So when I thought about it, I thought, well, they're quite new possibly and things like that. We've already heard in responses that we have comparator data from other authorities. We have comparator data benchmarking from national things. I know in some of these we have 3 years worth of information. So why we're asked to measure something but not measure ourselves against some kind of helpful KPI is beyond me. I don't really there may be well be an answer, but my question is more of an request. Could we get, the other question was, why are we getting Q1 and Q2 presented together? Why didn't we get Q1 when it was, back when it was more useful? Or do we, that's a question. Why do we get Q1 and Q2 together? But about the number of KPIs that we don't have any, it'd be useful just to get some assurance that the next time when we get Q3, we do actually have some KPIs that we can measure ourselves against. Thank you.
Thank you, Councillor Count. Would anyone like to comment, Patrick?
Yeah, so we'll work on the Q3 figures. I think it's because there's no targets and hence that's why it doesn't, but so we need to work on that. I think the reason you've got Q1 and Q2 is because of the timing of the reports. So Q1 would normally end in June and we would bring that paper in October. The way that the performance report comes to the committee is that we bring them every other, so that it's due to come in December. It's just a timing issue of it. So we will review the timing of committees and look to make sure that we can bring performance reports in a timely way to committee for adults.
Thank you. I think it's a fair point around some of the indicators, or most of them being still in progress and tested. And the question is like when they will not, they will cease to be in progress and actually will be able to have some measurable outcomes. So I think that's something that perhaps we can improve on in the next report when I have this paper. So I do agree with that point. Are there any other questions at all on this? So no vote is required on this item. We're being asked to note and comment on performance and if this Performance Information Act, if necessary. So I think we've all done this today. So I will move on to agenda item number 9. Which is starting from page 209 of the agenda pack, and Val Thomas, Deputy Director of Public Health, is here to present the report. So Val, over to you to introduce the report. Thank you.
Thank you, Chair. Yes, this report again is like Adult Social Care report. It's up to Q2 and it includes performance to date to Q2, but includes national comparators and our local targets as well. Starting with the positives, I think the Integrated Drug and Alcohol Service is exceeding its aspiration. Similarly with the Tier 2 weight management services as well, exceeding its aspiration. And again, if you're in the Healthy Child Programme or children, the breastfeeding is also really improved and now exceeding its local target as well. Of course, there's always a downside to exceeding targets. If you return into the drug and alcohol performance, our concern is that the improvement has been very much driven by the additional funding we've had from the centre. That funding is scheduled to end at the end of 25-26, which leaves us in quite a difficult situation. Obviously, we'll have people in service. We'll have, we really increased the numbers of people coming into treatment. Recruited new staff to the service, and there's been a lot of developmental work with instant housing in Cambridge City and so forth. So that is a big concern for us. And it's very difficult to develop an exit strategy because we expected nationally, we are receiving the funding we're expected to deliver. In terms of the weight management services, basically demand is completely overwhelming our service in effect, though we have taken measures to manage the demand and working closely with the ICB as well. But we do have up to a 6-month waiting list, 6 to 9 month waiting list for those services now. I think that's being driven to some degree by new drugs. I think many people have heard about the drugs that are now available, whereby I think the public perception of it, this is a quick fix to some degree, or perhaps an easier route to losing weight. Secondly, the incentivization payments for GPs to refer, which is great to have that engagement, but it does mean that going forward, we are having to carefully manage that demand. Of course, alongside the positives, there are the things that we are concerned about. Firstly, I will comment about NHS health checks. It is red, but I think it really has improved considerably. We've worked extensively with GP practices. We've worked with the ICB, and I think the focus on cardiovascular disease has certainly helped. And we are expecting from the results we got in for Q3 so far, we haven't got them all in. Our anticipation is that we will meet our local target, but it doesn't end there because we have a national eligible population. And if we're going to have any traction on our cardiovascular disease, then we do need to hit that percentage. But we are certainly going in the right direction, and we anticipate being above the pre-COVID figure at the end of this year, because of course that decimated our figures, the pandemic. Our concern is around stop smoking services, well, stop smoking in general. It's still being affected by busy GP practices. We've looked at different delivery models, and we've commissioned other providers, but still it's been quite hard to improve that figure. We will have additional funding coming next year. There's been, I think I brought here a paper in the summer, and also the consultation progress came here, the consultation on a smoke-free future. And that will be ring-fence funding that will be from April going forwards. We don't know yet the terms and conditions of that funding. We're expecting at any time, but we do know it will be focusing on risks, groups where they have high smoking rates. So for instance, homeless population, people in mental health services, which are more challenging and are certainly going to have to require intensive efforts. Alongside that, we have a system-wide tobacco alliance, and we are reformulating our strategic plan, but it's more like a delivery plan in terms of how we are going to be ready for this additional funding. And that includes addressing such issues as vaping, as well as and illegal tobacco and illegal sales, as well as having very robust stop smoking services. In terms of the Healthy Child Programme, I think there has been some progress there, and a lot of work has been undertaken looking at skill mix and how the service can be delivered in a different way, so that we can meet those checks, to meet the number of checks required in the time frame. And that, as you can see there, there's been an increase from last year, and an ongoing increase from Q1 to Q2. But there is more work to be done, and that is a work in progress. And there is a lot of focus on looking at how we can make sure that those checks meet the target level and within the required time frame. So happy to take any questions on those.
Thank you, Val, for the report. Councillor Bowden, please.
Thank you, Chair. Looking at this in the wider perspective, and RAG ratings are there to give us a very quick, easy view of how things are going in any enterprise. And we have 9 measures of RAG ratings, 4 of which are red. On first view, that isn't a particularly good position to be in. But I would like to concentrate on one particular item. And first of all, I should place on record my thanks to Val. I think that the work that she does is tremendous. She gives us a lot of information, and I have a great deal of respect for the work that she and her team do. But I'd like to concentrate on Indicator 56, the Stop Smoking Services. Now, I must admit, I wasn't aware of some of the information here before this paper was published. I wasn't aware that there had been problems with 2 of the main smoking cessation pharmacotherapies, that they'd been withdrawn because of safety issues. I wasn't aware of that. And hadn't been aware of the shortages of nicotine replacement therapies. So I hadn't been aware of all of those, but nevertheless, the figures are poor. And I don't know how well aware the committee is of just how disparate the figures are across our county. There are almost 200 district, unitary, metropolitan borough, London borough councils across the country. And as far as they're concerned, if you look at South Cambridgeshire, for example, or Cambridge, we're doing really quite well compared with the average around the country. If you look at Fenland, of those almost 200 local authorities, we're the absolute worst. It's the worst in the whole country. And it's clearly an unacceptable position for us to be in. And that's why I was delighted to read in this report at the bottom of the Indicator 56 narrative that new stop smoking projects are being developed in Finland, and the NHS neighbourhood managers have committed support to promote and develop local clinics. And I wonder if Chair, through you, Val may give further information about those proposals, how quickly they're going to come on board, and what we're hoping to achieve in terms of the improvement of the current unacceptable position. It's quite unacceptable that one of our district councils is the worst in the country so far as smoking is concerned. And perhaps, Chair, I should have introduced this little question by saying, maybe declaring an interest. I've never been a smoker, and I'm a virulent anti-smoker. So I should perhaps have declared that at the very beginning. But I think that we all should be very much anti-smoking, given the effect that it has on people's health. Thank you, Chair.
Thank you, Councillor Bowden, and I do agree, like it's a really an unacceptable situation, particularly looking at the Finland area, and we do need to do more progress. Now, I'll be also curious to know, especially around the progress of some of the pilot projects we're having. I believe we have one in Finland, part of the Closer to Communities work that I think the COSMIC Committee, Communities Committee, will have a report in a few months' time, perhaps in the next committee, if I remember correctly, on that. But meanwhile, if Val would like to provide some further evidence and insight into the work in Finland, that would be very appreciated. Thank you. Microphone is not on. Thank you.
It is one of the Closer to Communities and decentralisation projects. And just the thing about the data is that Councillor Bowden is absolutely right. We were shock horror when it went up to 27% last year, the highest in the country. The latest data has come back down to closer to Cambridgeshire levels. But I think there's a kind of query around the surveys that have been done in Finland, because we've had those swings over the years. And we did do a deep dive into the practices in Wisbech particularly, and found that it's probably around 19 or 20% given that data. So it's still higher. So, you know, I think that's why we are focusing this efforts in Finland. The work is focused because we know what's coming in terms of the focus on population groups which have higher rates. The service is open to everyone, but the approach is different. So we're working closely with the Ferry project around the homeless population, and with all their links to the different housing support areas within Finland. We're also working with the neighbourhood managers and wanting to put 2 posts into one post in each area. One post to work with the homeless population and another one to work with primary care. And for them, and also to have, for instance, in the Ferry project, people trained to do stop smoking. They know their clients, they know some of the barriers to stopping smoking that could be found amongst this particular client group. And because in the past, all our attempts have been quite challenged working with these groups. And I think probably we'll have an added advantage because we are doing the behaviour science research that we've commissioned with Sheffield University, and that's being undertaken at the moment. Well, again, will help us identify some of the barriers which we know have resisted or perhaps not receptive to our services. And on the primary care side, we want someone to be embedded in with the integrated neighbourhood teams and with the social prescribers, because we know there are people that are going through practices there that perhaps aren't being picked up. Practices are pressurised and busy, and we do need to have a focused attention on smokers, because very often smokers, the people who we know who smoke generally end up in primary care at some stage in their life. So it's a very good time to target those. And in addition, the NHS has a programme in acute hospitals, a treating tobacco dependency programme. And what we want to do is, and that involves the acute units and pregnant smokers, is to make sure that the pathways as they come out of hospital, having started a quit attempt, that they are picked up straight away when they go into the community. So there are 3 kind of streams to the work in Finland. The homeless, because we know, and that includes the Eastern European population as well, which has a high smoking rate. And the primary care focus, and again, picking up on people that have come to the acute unit because are smokers and have been offered support within the acute hospital, and to actually form a small team within Finland to ensure that people are identified, worked with, and supported to engage with the services.
Thank you, Val. Councillor Bowden, please.
Thank you, and I'm very grateful to Val for the further information given. One thing which was missed there, which I found quite interesting, was no specific reference to one particular cohort of individuals who have a significantly higher rate of smoking than others and who are more difficult to reach in some cases, and that is the population from Eastern Europe. Now, as you'll be aware, Chair, it is particularly difficult when it comes to primary care because our system of health, our health system is quite different from quite a number of those in Eastern Europe, particularly those from the former Soviet countries. And we have a relatively low take-up of primary care services by our residents who have come from Eastern Europe. Yet those are the individuals who constitute a very significant number of individuals. Unlike the homeless population, which is a relatively small number, we're talking about a relatively large number of individuals here whose prevalence for smoking is particularly high. And I'd like to suggest or ask Val if there is something which can be done to ensure that those individuals who may not have a particularly close association with our primary care system can be targeted in order to ensure that that population gets the benefit of the services that we're trying to give here.
Thank you, Councillor Bowden. I think Val did mention in the context of the work with the homeless population, specifically this group of Eastern European people, but I do agree with you. It's more about like the broader migrant population, especially from I would not only say like Central and Eastern Europe, but there are many countries in which actually the rate of smoking in the adult population, at least when I grew up in Romania, was like 1 in 2 people used to smoke. So of course, if you come from that kind of background, it is not surprising that you'd have like higher rates. And also like I do agree with your point on awareness, because often people who just moved recently to the UK are just not aware about the services that are available to them, or perhaps not trusting of the services, or perhaps they need some other type of outreach or encouragement. But I'll let Val come back to that point in terms of what we're doing more specifically with this group. Thank you.
It's my fault because we already do work with the Rosmini Centre, which is the community centre in Wisbech for the Eastern European communities. I just didn't expand enough on it because we've been working with them for a while. But you cannot avoid the smoking rates in the Eastern European population. Absolutely agree.
Thank you for that, Val. Councillor Slatter, please.
Thank you. This is on number 82, where I know it's blue and it seems like we're doing well because we're getting lots of referrals, but obviously we can't cope with the number. And we don't want to discourage people because it's a big effort to even refer yourself or ask somebody to refer you. In the budget where we were talking about where there is a budget line, I believe, to do with this, is some of that money going to be spent on the introductory to a weight loss club offer that we make, where we buy people perhaps several sessions to get them going, that they then can carry on with? Because I do feel that I can't name the names, but I do think that the clubs that meet locally and they encourage one another is one of the most effective ways of helping people to get into the habit of eating the right things and doing the right things. Are we investing in that with some of the new money we've put in the budget?
Are you talking, sorry, I am. Are you referring to the commercial slimming clubs or the commercial? Yes, we do invest in them. Our main we have 3 different providers now across weight management, and the main one subcontracts with those, and they're incredibly helpful because we can, they have quite a lot of additional capacity. They're well evaluated and people like them.
Thank you, Val. Councillor Sif, please.
Thank you, Chair. We have, I don't know how many in the course of this year, committee meetings on this I've attended, but I think on every occasion we've talked about smoking and anti-smoking campaigns. And perhaps worryingly, not for the first time today, I'm in full agreement with Councillor Bowden. He's made many of the points that I would have made, because that is the standout statistic in this report, 31%, whatever it is. But are we beating ourselves up unnecessarily? Because practically all of the other measures are under the control of county and our officers and our campaigns. Giving up smoking is something that we are reliant on individuals to do. And as you've quite rightly remarked, there are many categories in which they could be divided. I just wonder whether putting one statistic, where did we get 1,906 target quitters? I mean, how do you come to that figure? But it seems to me that we are unnecessarily beating ourselves up, as I've used that phrase. I mean, it seems to me probably more important that young people be persuaded not to smoke or not to start in the first place. And I know we have a campaign moving in that with that objective. But clearly, certain groups, the older groups and Eastern Europe, is much harder to convince. And I just wonder whether it might be better to divide the stat so that we don't look at these red failures almost constantly. I'm sure that the new campaigns that are being introduced will have an effect, but I mean, we could end up still with another 30% despite all the money that we're spending on this. So I just wonder whether we should be prioritizing and producing a statistic that's more realistic in that context.
I think with young people, you're right. About 85 to 95% of smokers start before the age of 19. So it's your obvious target group. Not interestingly, it's young people's attraction to smoking to some degree has been undermined by vaping. And so a lot of our work at the moment is focused on getting sort of messaging and working with schools and the wider communities and parents about the dangers of vaping for young people. There's a lot of evidence that it's incredibly good for adult smokers in terms of helping them have a successful quit attempt, but we don't have enough evidence from younger people. So that's where the focus of our attention has been. And I think the value still of focusing on older people is that no matter at what age you make a quit attempt, you stop smoking, it still has an impact on health outcomes, and there's cost-effective evidence for it as well.
Comment is more about the stat. I'm sure you're doing
Yeah, I know, but I can't sum it up because we don't have. This is an adult service. You see, that's the problem. We work with young people and offer them, but it's usually it's not a straightforward offer, and this is driven by a national indicator. A 4-week quit attempt with support. With young people, it's somewhat different, and it's more about a conversation and a discussion and working with them rather than saying we think you should come and do a stop smoking attempt. So it'd be quite hard because we don't systematically collect that data because they don't access the service in the same way.
Thank you. Do we have any other comments or questions on this? No, in that case, no vote is required on this item. We are asked to acknowledge the performance achievements and support the actions undertaken where improvements are necessary. So thank you very much again, Val, for presenting this and answering our questions. I sense there's consensus, especially around the stop smoking services and the further work we need to do in Finland, but also other areas where smoking rates are particularly high on this, and work together towards prevention and public health messaging on this issue and around public health more broadly. I'll move on to item 11 on the agenda, which is the Adult and Health Committee agenda plan, training plan and committee appointments, which can be found on pages 219 to 236 of the agenda pack. So would the Democratic Services Officer, please could you highlight any changes to the published agenda plan at Appendix 1 of the report?
So we've got one additional report, and it's recommissioning of prevention of sexual ill health services, and that's a report coming from Val.
Thank you.
Sorry. The additional report. Yeah, the additional report, because you had one report, but
Okay, thank you very much. So are there any comments in relation to the agenda plan from members at all? No, in that case, I will take that as noted. And Are there any comments in relation to the training plan from members at all? No, this has been noted as well. So in that case, with 3 minutes till the end of the meeting, we are finishing this committee. Yes, I am always on time, so thank you very much for all your comments, scrutiny and questions today, and have a safe journey home. Thank you.
Thank you very much.